a full quorum today. And we have a couple of matters. I think we have the State Board of Land Commissioners, and then we also have the State Board of Loans and Investments, and we're here in a special session. I guess what I'm thinking, Madam Director, is that we should convene. I think we have a couple of matters that are appropriate for executive session to begin with, one in each session, and trying to get the formality of this correct. It seems to me that we can convene as the Board of Land Commissioners and then move into executive session if that's appropriate. And then I don't know if we come back and then reconvene as the State Board of Loans and Investments, and my sense is we will then also have a small executive session before we begin the public session.
Mr. Chairman, I did check with our legal beagles on this. And as you mentioned, this meeting has been noticed as both a special meeting for the State Loan and Investment Board and the State Board of Land Commissioners. We've also noticed an executive session for each of those boards. And as long as it's clear that we are convening into executive session to handle matters both related to the Board of Land Commissioners and the State Loan and Investment Board, they're of the feeling that we don't need to come out and reconvene,
Okay.
that we can address them all at the same time.
All right, all right. Well, that is, I think that's a good order of business. So I will say we have a quorum present for both boards, and I would entertain a motion to enter executive session. It's been moved by the secretary. Is there support?
Second.
It's been seconded by the superintendent. Is there any discussion?
Mr. Chairman, I would just note that the assumption is that motion is so that we may receive legal advice under both boards.
That is correct.
Okay.
Yep. Thank you. Thank you for the clarification. That should be in the minutes. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
We will, I think, move to a separate room, so make yourselves comfortable. We'll be back shortly. Thank you. to order as our, after the executive committee or executive session. And I just sort of preface a couple of things here. We want to make sure that we get through this process respecting all of your time. We want to make sure that everyone who has made the trip to get here has a chance to speak to projects that are of interest to them. We wanted to refresh ourselves on both the federal and the state law, and just so people understand that while they may be passed here, they still have a couple of traps to run. And of course, the good auditor always reminds us about the potential for audits down the road. And why that's important is that the federal government could well come back for that funding. And the way they do that is by not sending you money for mineral royalties grants and things like that. So they will get their money back. But we are, I think, as a board, have spent quite a bit of time working through these. So Madam Director, I'd like you to sort of kind of outline what we have before us. Members of the board, with your leave, what I'd like to do is sort of entertain a couple of suggestions about how to proceed, just so that people in the audience understand what the process might be. I want to assure everybody in the audience that as chairman, I'm going to make sure we don't get into interminable loops on process, that we actually deal with the things that are at hand. And it is our intent to try to do as much as we can today. And then we also have a session in the afternoon tomorrow if we have to head over. Madam Director, have I missed anything? And otherwise, I'll turn the floor to you.
No, Mr. Chairman, I think you've summarized it fully. So for today's agenda for the State Loan and Investment Board, this will be the J1 matters, which are to consider funding recommendations for Health and Human Services Capital Construction ARPA grants. The American Rescue Plan Act Health and Human Services Capital Construction Program was created during the 2022 budget session of the Wyoming Legislature. As you know, the legislation appropriated $85 million to the board for grants to be awarded for Health and Human Services capital construction projects. Of that amount, $63 million is available to any applicant for qualifying projects. $7 million is available only to community mental health center regional stabilization facilities and women's substance use disorder facilities for qualifying projects. $13 million is available only to rural health clinics for qualifying projects, and $2 million is available only to eligible rural telehealth pilot projects. All grants that are issued by the board must meet all federal and state eligibility. Under ARPA, all projects funded under the program must be a direct and proportionate response to COVID-19 or its negative economic impacts. And all funds must be obligated by December 31st of 2024 and fully spent by December 31st of 2026. They can only be used for costs incurred on or after March 3rd of 2021. As you know, the program has been proceeding under Chapter 40, the rules promulgated by the State Loan and Investment Board. Those rules are based on guidance from the U.S. Treasury Department and the requirements of the authorizing state legislation. Applications for this program were accepted between July 1st and August 12th of 2022. They were either received directly by OSLI or they were submitted through the state's ARPA portal, which is managed by the Budget Department. As per the rules, in order to assist the board, OSLI has calculated a score for each eligible project application. The board is free to utilize that score in evaluating the applications or not. Additionally, these applications were reviewed by the Department of Health and the Department of Family Services. We have provided a list of all eligible project applications, which include the raw scores. I would note that Director Johansson is here from the Department of Health, should the board require his assistance with any questions. So fast forward, the board on November 16th took their initial stab at awarding grant funding under this program. They approved 12 program grant applications totaling $33,631,256. The board also tabled 7 grant applications, which can be untabled and considered at today's special meeting. Since the November meeting, OSLI staff has worked with applicants to on their submitted written justifications and discussed eligibility concerns, and in order to provide the board with the strongest possible applications and justifications, we accepted updated and/or amended information for the applications through noon on December 5th. So with that, I will note too that the Chapter 40 rules do not require the applicants to have their full required match in place prior to the board awarding the funding. We will continue to work with the grantees to make sure all that's cleaned up on the back end. If we have issues, we will bring them back to the board. So there are many ways to proceed with this, Mr. Chairman, as you've noted, and I'll turn it back to you. But I think that the first thing would be to recommend that the board untable applications 1024, 1059, 1062, 1072, 1100, 1101, and 1127. They were the ones tabled at the last meeting. Those can be found under the director's recommendation in the board matter.
Madam Director, let's dispense with that to start with. If a member of the board would like to move to untable the matters that are on the director's.
Mr. Chairman, I would move to untable applications 1024, 1059, 1062, 1072, 1100, 1101, and 1127.
Is there support for the auditor's motion? It's been seconded. All in favor signify by saying aye.
Aye.
Those motions are now suitable for action at today's meeting. Madam Director, the only other thing I would, I note that the Department of Health is here. Do we have somebody from the Department of Family Services here?
Mr. Chairman, it's my understanding that Director Schmidt is on an airplane, so Director Johansson is pinch hitting for both today.
Pinch hitting for both. Okay, thank you. Just so people understand, if there's, I'll try to, on a regular basis, recognize if there's any particular issues that you want to bring up. Try to keep as clear as possible as we go through. So I'm going to walk down in order through the board. Mr. Secretary, I think just sort of outline, various approaches that we could take on this. I wanted to give you a little bit of time to kind of express your thoughts on this.
Thank you, Mr. Chairman. I think that as many of us have gone through every one of these applications and looked through them all, I think off the bat that maybe we could look at ones that we may want to vote to deny, get a couple of those out of the way. Of course, that would be on, I have some of my own opinions on some of these that I think that we could vote to deny and get those out, and then we could start going down through the rest. If somebody has a one that they feel strongly about or so, that we could bring those up, but once then they come on the table that or they're brought up and they're on the table to discuss, then we go for any public comment on there. That anyway, that's my thoughts, Mr. Chairman.
Sorry, thank you, Mr. Secretary. Madam Auditor.
Mr. Chairman, I think the Secretary's idea is a fine one, and apart from that, or after that, then I think that actually just going through them one by one in order is maybe the best idea.
Okay, thank you, Madam Auditor. Mr. Treasurer.
Well, Mr. Chairman, I assume there's going to be availability for public comment once that consent list is developed before we vote on it.
Mr. Treasurer, if there is a consent list, as I mentioned, I think I'll provide, I want to make sure everybody has an opportunity to speak to projects within a reasonable time. Any further comment, Mr. Treasurer? Not at this time, Mr. Okay, thank you, Mr. Treasurer. Mr. Superintendent.
I would agree with the Secretary, Mr. Chairman, to dispense with those that are, that don't make the criteria, that are an obvious no, and then to work our way through the list in order.
Okay. Very good. Well, if that's the case, then the floor is open for any, the one other thing that I would say is that we are not compelled to dispense with all the funds today. We can certainly do that, but there is, opportunity for revisiting some of these projects should that come. Our intent, and I think that is shared by all, is that we don't want to keep delaying, but we do want to make sure we're correct in this. Mr. Secretary.
Thank you, Mr. Chairman. I would move that, go down through some of these. 1021, Memorial Hospital, Sheridan County. 1023, Memorial Hospital, Sheridan. 1039, the Sweetwater Medical Office Building renovation. 1042, Thane Senior Center. 1087, the Health Department Facility Relocation and Expansion. 1141, Basic Beginnings Playground Safety. 1143, True North Academy. 1244, the Hub on Smith. 1245, Sage Living. And 1250, Teton County Hospital on-call rooms. I would move that we vote not to fund those. That they're zero.
All right. That motion has been made. Is there support for the motion?
Mr. Chairman, I'll second the motion.
Okay, so we have a motion on the table not to fund 1021, 1023, 1039, 1042, 1087, 1141, 1143, 1244, 1245, and 1250. That motion is on the table. Is there discussion? Is there discussion? So here's my issue. Normally, we would sort of think about putting these on a consent list, and that would allow members to be able to remove these items and allow them to be spoken to. At present, we have a motion not to fund these, which either succeeds or fails. If it succeeds, these are all denied completely. That is the notion of the motion. I don't know if that's exactly what this board had intended to do. I don't know if everybody, I certainly have some questions on some of the projects that are here that I'd like to hear a little bit more about. So, members of the board, what is your pleasure?
Well, Mr. Chairman, I guess I'd ask for public comment on any person that wants to comment on these. Other than that, I don't have anything specific without hearing from somebody that's really wants to make their case. And if the case is clear that they don't fit the criteria of the program, then that's a clear decision.
Okay. Well, without objection, understanding this is a little bit out of order, what I will do then is to entertain each of these projects for people to speak to them on an individual basis. And then, as my understanding, members of the board, if you find something compelling in any one of these projects, you must vote to defeat the motion. And then we can consider it again. So with that, 1021.
Mr. Chairman?
Yes.
I think, can you amend the motion to?
You could amend the
If he
motion.
did, yeah, you could,
Yeah.
okay, all right.
So, 1021 Memorial Hospital of Sheridan County, supply chain reallocation and expansion, priority 3 of 4. Is there anyone from Sheridan? I have Mike McCafferty, and if you'll all bear with me, I'm trying to track both what's in the room here and what's online, but I have Mike McCafferty from Zoom. You may have the floor, sir.
Mr. Chairman, thank you very much. Mr. Chairman, Governor, board members, just want to, my name is Mike McCafferty of Sheridan Memorial Hospital. I just want to say thanks for the opportunity to address you today. I appreciate the situation you're in with all of the projects and the limited availability of funds. I want to talk to you real quick about, if I may, both 1021 and 1023. Certainly we have still on the agenda 1024, which I also want to address with you in turn. But 1021 and 1023, if I may speak to those are the two that you just put on your list to deny. First of all, the supply chain relocation expansion project is a project that is very important to us. We believe is a direct and proportional response to COVID and the pandemic. In particular, this area of our hospital is a 1954 vintage. We have had a dramatic increase in having to stock inventory from about a week's worth of inventory to over 45 days because of national supply chain issues. What this project intends for and allows us to do is to increase our warehouse spacing from around 5,000 square feet to close to 10,000 square feet. It's a project that in total is a $1.2 million project. 608,955 of that would be requested from the Slib board. This is very important because it has a great deal of impact on the way that we do business every day, and the investment that we have in our inventory has increased by about $1.5 million. So it is a direct and proportional response, and I would ask you to consider that as a project that you would fund. The other one is an extension 1023, an extension of our funds that were approved from last year, which were related to the HVAC system for 20 room surge capacity for Sheridan Memorial Hospital. This allowed us to put in HVAC units on our second and third floor. What we're asking for is the balance of the HVAC distribution and electrical systems for that unit that would be funded. This is a $2,009,856 project, of which we would be asking $1,004,928 from the Slib board. Very important. It allows us to segregate out our skilled nursing patients and swing bed patients out of the general medical unit, and to be able to have negative air private rooms for patients in those areas. So those two projects are very important to us, and I appreciate the time and consideration of those, and respect the hard job that you all have. So thank you very much. And again, thank you for your support with the behavioral health project that you approved for us last month. Thank you. Any questions?
Thank you, Mr. McCafferty. Are there questions from the board? Are there questions from the board? Now, I will note that this got a score of 14, which is reasonably high. There is some moderate concern about whether they go. Mr. Johansson, any color on either of these projects? Any other conversation?
Mr. Chairman?
Yes, ma'am.
Not specific to this project, but I think it's important as we go through today. One of the things that I will be looking at, and I don't know about the other board members, speaking only for myself, the scoring is important, the risk is important. I will be taking both of those into consideration. But simply, we have a large and rural state, and I'm also very much going to be looking at what sort of CARES money each of these entities received already. We have a lot of entities on this list that have received a large amount of money, and we have quite a few entities that receive no CARES money. And then additionally, I would be looking, for example, in the case of Chardon Hospital, money that we have already given to them out of this pot of money. So just, again, not specific to this project, but that's something I'm going to be looking at, is what sort of funding they got from CARES. Again, not that reduces the need they have now, but just looking to spread a very limited amount of resources amongst a very large and rural state.
Okay, thank you, Madam Auditor. Any further discussion on either 1021 or 1023? Hearing none, we'll move on to 1039. This is the Memorial Hospital of Sweetwater County Medical Office Building Renovation, Priority 2 of 2. And here I recognize Tiffany Marshall. Ms. Marshall, the floor is yours.
Hi, good morning, Slib Board. I'm Tiffany Marshall, and I also have Irene Richardson here from Memorial Hospital, Sweetwater County. This medical office building renovation is important to us, but we respect your process and we are fine pulling the application.
Okay. Any comments, questions? Hearing none, thank you. We'll move on to 1042. Thane Senior Center, Lower Valley Regional Human Services Facility. And here I see Melinda Pebbles. The floor is yours.
Thank you very much. I appreciate you and the board allowing us to speak on our project. This project's really important to our community. We serve Alpine, Auburn, Etna, Bedford, Freedom, Star Valley Ranch, Thane, and Turnerville. So we have a huge area that we're trying to service. And most of the things that we have on this project are not available in our small rural areas. We're looking for additional space for our senior center to serve that vulnerable population, as well as the community as large. We need telehealth space. We need community space for blood pressure clinics, as well as flu shot clinics and COVID shots. Lots of evidence-based health education, flu shot clinics, as well as community resources and education and mental health services. This is really needed in our area to serve our communities, and it's really important to our area. I don't know if you guys have any questions or need additional information.
Thank you, Ms. Pebbles. Are there questions for Ms. Pebbles?
You, Mr. Chairman?
Mr. Treasurer.
You probably can't do this, and I don't know whether we can handle this application today, but you mentioned several things that are COVID-related, health-related, that are, I guess, available under this criteria. And hopefully the legislature will change some of the criteria if they can, to a certain degree, if they move forward. But do you have a dollar figure on the amount of things that could possibly be COVID related?
I don't have an exact dollar figure. We have phased this down. We were trying to get the entire project, and to meet the COVID regulations, we phased that down into 2 separate phases. So this first phase would be 11,215,000 compared to over 14 for the entire facility. And that was to meet the COVID regulations and make sure that all the space that we had was specifically for COVID related expenses and different things that are happening that we need in this community.
Thank you, Mr. Chairman.
Thank you,
Thank you.
Ms. Treasurer. Further questions? Further questions? Hearing none. Thank you, Ms. Bevels. So we now move down to item 1087, County of Natrona, CNCHD facility relocation and expansion. And I see both Representative Sweeney and Mr. Nelson. Is there anyone in the audience here, just in case I miss anyone? Mr. Nelson, I see you listed first, and then I'll go, or actually, sorry, I'm going to let Representative Sweeney proceed first. Representative?
Thank you. Governor, can you hear me?
We sure can.
So I would respectfully ask if you could let the county attorney go first, and then if allowed, I would go after he and Anna Kinder.
All right, thank you, Mr. Sweeney. Mr. Nelson?
Thank you, Mr. Chairman. Can you hear me?
We sure can.
Thank you. Good morning, Mr. Chairman, members of the board. My name is Eric Nelson. I am the Natrona County Attorney, and I'm appearing here today on behalf of the county and the Casper-Natrona County Health Department to request funding to support the construction of a new public health facility. Just preliminarily, after the last meeting, we met with staff and really sharpened our pencils and revised our ask down from the 10 million initially to the 5.1, which we believe is directly and proportionately related to the COVID response. Just by way of a little bit of background, back in March of 2020, the Casper-Natrona County Health Department was really the tip of the spear, not only for Natrona County, but for much of central Wyoming in responding to the COVID pandemic. As the pandemic progressed and progresses yet even today, the health department is front and center in providing testing, vaccination, and even outpatient treatment for COVID. And what this experience has taught us in the county is that the current health department facility is really inadequate to meet the needs of the community, especially with regard to the COVID pandemic. The Natrona County Commissioners undertook a very methodical process to determine the needs. We hired an architectural consulting firm with specific healthcare expertise. Ms. Kinder engaged a programmatic study with the National Association of City County Health Officials to determine the needs of the community, which led to several main conclusions. First, that the current facility is too small, not designed for public health, beyond its useful life, and cannot be retrofitted. Second, there are no existing buildings within the Casper area sufficient to meet the public health needs of the community, and thus a new facility should be constructed. And lastly, many of the features of this new facility are a direct and proportionate response to the COVID pandemic. And I would add that as the first Natrona County entity to come before you, what we are asking for funding is to support those aspects that are COVID related. And so to go into a little bit more detail on the specifics of those, Mr. Chairman, I would ask to turn the podium over to Ms. Kinder so that she can discuss in more detail for the board how these requests are directly related to COVID.
Thank you, Mr. Nelson. Ms. Kinder?
Good morning. This is Anna Kinder. Are you able to hear me?
We are.
Thank you very much. I do appreciate you allowing us to have time to speak with you. Very sorry I was not able to join you in person. I was able to attend all of the other meetings, but winter decided to make its presence. As Eric said, I am the director of the health department. I've held this position since July of 2019. I'm very proud to say that I'm a native of Wyoming, as are my parents. I've worked at the health department for 16 years and have seen over time, especially and most directly in the last 3 years, the wear and tear on this building. We are and continue to be the immediate front line from the beginning to end of the COVID response. I just want to highlight a couple points of our response to COVID and how the building has not proven its worth at this point. We are operating out of sea cans that we are putting on borrowed land from the city of Casper to continue to provide our COVID testing due to the fact that our waiting room is extremely small, only able to accommodate 19 people. We're not able to isolate well from sick individuals, both from the public as well as staff. Obviously, staff are asked to leave the facility. We have very limited storage requiring multiple locations that we have things, especially those items that need to be temperature controlled. Parking has been extremely limited. We've had multiple times that people have parked all the way up and around the block just due to the fact that there is nowhere else to go. We are extremely landlocked where we're at. There is absolutely no ability to expand. Safety of the staff, we have very inadequate workspaces. Most of our spaces have a lot of COVID materials that we utilize from day to day, as well as our regular programmatic activities and items. There are no more areas that we can put additional items or staff unable to even remotely begin to expand or provide additional services. It is extremely hard to recruit healthcare workers at this time, as you well know, but continuing to be at a facility that really does not have optimal workspace, the ability to move freely and also get new and improved equipment into the facility, we're not able to do that with our current location. We're not able to secure things. As you know, a CCAN is typically moved from multiple locations. So we're not able to really super lock our facility. There are bars on the windows. There's a single door lock that goes into our storage space. And we have inadequate lighting. As you know, it's dark in the morning. Most days and in the evening, it gets dark pretty early and we're continuing to provide testing. We used to use a modified fifth wheel trailer that we did testing in the alley, which often blocked the alley and around the building multiple times. I provided statistics for you in the packets to talk about the things that we did from the onset of COVID as through the current situation. We continue to have between 60 and 100 COVID cases every week that we actively provide testing, vaccination, and at times treatment. We have identified over and over again from the very beginning that drive-through has been the biggest asset that we have available to us. It allows people to come to the facility, not leave their cars, not having to find a parking place. We're able to get through a lot of people. At one time during a vaccination effort that we did at the Ford Wyoming Center, we provided over 700 vaccines with 6 lanes to provide the vaccines. We had traffic all the way down to the Ramcota from the Ford Wyoming Center just to accommodate the number of people that came for those boosters when they first came out. Security continues to be a great issue for us. We did receive multiple threats, as well as we're not able to secure some of our highly sought out vaccine at times. So we're not able to facilitate some of that. I just ask you to reconsider due to the fact that we are doing absolutely everything that we can to protect our community and look forward to continuing to do so. So I would like to turn it over to Commissioner Peter Nicolason, just as a follow-up point. And again, thank you so much for your time.
Thank you, Ms. Kinder. Mr. Nicolason, I see your hand raised. Commissioner.
Thank you, Mr. Chairman. Thank you, Board. Can you hear me all right?
We can.
Sure appreciate all the time you've spent over the last number of months and the time that staff has spent on all these applications. I just wanted to let this board know that the county commissioners are very much in support of this application. We've been working closely with the city of Casper, and it is also very much in support of this application. We would certainly think that our application meets the standards and would stand for any questions if you have any. Thank you, Mr. Chairman.
Thank you, Commissioner. As I said, I would recognize Representative Sweeney at the end of the other testimony. Representative Sweeney.
Thank you, Mr. Chairman. Can you hear me okay?
We can.
So thank you for all of the work that the board has done on this, and staff has done unbelievable work. I ask you to put this back on the consideration list and take it off. I think our locals have done unbelievable work in trying to make this application, as was previously stated. We started out at the 10 million ask, and then working with your staff have redeveloped it to be more in line with the U.S. Treasury rules. As to the question that Auditor Racines asked, I don't have those exact numbers, but rest assured that our county has put those monies aside to work on this particular project and have the funds available to move this project forward. Having been a recipient of care at our county health department, city county, the tip of the spear is exactly right. We were the only facility at the time that jumped on board and got one of the freezers necessary. So we were able to distribute and help the state with a distribution network. Whether people believe in or not in the vaccines, I do. And a lot of us in the legislature do and appreciate what our state Department of Health has led the way on. But your Natrona County facility did unbelievable work regionally, trying to help people mitigate the factors. Myself, I got my second shot at the health department because that's where I was directed by the first clinic for Moderna. I've also gotten boosters, also under recommendation of doctors, another drug because of a drug I'm on that weakens my immune system. I think my point here is I've been in the back rooms, back spaces. We are out of space. It's not safe for our staff. And we really, I believe, Director Johansson could verify, we have been on the leading edge with the state on trying to mitigate our deaths and help the state. So with that, Mr. Chairman, I would respectfully ask that you amend this consent list and pull the Natrona County facility. If we could remodel, if we could expand, our commissioners have gone through a great deal of thought process in putting this all together, and didn't start yesterday or after the legislature met in March. This was ongoing, and that they have developed this plan. With that, thank you, Mr. Chairman, for some latitude, and I would appreciate your support on pulling this off the list.
Thank you, Representative. And just as a point of order, and I'll recognize the treasurer here in just a sec, this is not a consent list. This is a motion to deny. Mr. Treasurer.
Yeah. One thing, Mr. Chairman, in this sheet that we've got here, as far as, and I do recognize it says it's for confidential attorney-client communication. I want to make sure that I can quote this in this area here. I don't know whether I can or not. I can't, but I guess I'll quote it in generalities, Mr. Chairman. What I say is that I believe the Natrona County Health Department, when I was with them in my office, they were the only entity that came forward in this whole process that actually has statistical information on their COVID cases and historical in their perspective. And today they quoted that they've had 60 cases, and I think they may have had one death. So, you know, I think that they've demonstrated more than any other applicant that I've seen information, but although it be, you know, to me in my office, that that there is a continuing harm within their community, and that is exacerbated by COVID. And they're doing the best that they can, but the size of the community and the constraints of the possibility of logistically increasing the needed footprint, they're just too constrained in the area that they're at. And this, I think, is the only viable option. I don't believe there's really a least cost or less cost thing that's going to be viable, you know, in the future, given the security issues and other issues that are having a kind of a makeshift solution to an ongoing problem. And I fully support this particular effort to take the bull by the horns and get it to the ground and go to work on this, Mr. Chairman.
Okay, Mr. Treasurer, thank you for that. I'm pondering an approach to this that would be elegant and efficient. So give me a second. I don't know, Mr. Johansson, any particular color you want to add to this? And while you're coming up, Mr. Treasurer, you know, it seems to me, per your suggestion of amending, you could amend this out, and then it would not be part of the conversation here.
Mr. Chairman, I think what we do is finish this list, and then you'd ask for amendments.
Yep.
And then I'd bring that forward.
Yep. Thanks. Okay. Thank you.
Mr. Chairman, members of the board, Stefan Johansson, Director for the Wyoming Department of Health. Just general comments per the discussion here. I would echo Representative Sweeney's comments that Natrona County Health and all of our public health offices around the state have been excellent partners through the pandemic, and have done great work amid some very challenging circumstances. Mr. Chairman and members of the board, to be quite honest and blunt in my review, and I think this would be echoed by Director Schmidt's review, certainly no commentary on the the need or the quality of this proposed project, there were concerns about two things. One, the proportionality given the request of $10 million, and two, the ability, as we've all seen in the Treasury guidance and regulations, the timeline for completion, which will generate additional scrutiny from the federal government. Mr. Chairman, as far as I'm aware, and anybody could countermand me on this if there's more up-to-date information, the estimated timeline on completion, I believe, was December of 2026. Certainly I believe within the allowable spending of the Treasury guidance, but again, on capital construction projects, it's been articulated in the guidance and regulations that anything falling outside of basically a 24-month period will face some additional scrutiny. So from the health department's perspective, certainly recognize the issues Natrona County Health has pointed out in terms of the physical space and the physical plant, but wanted to bring that to once again to the board's attention.
Thank you, Mr. Questions?
Just pointing information that it's not a $10 million request now. It's been modified to 5.1. That should help substantially with the proportionality aspect of your concerns. And I don't know whether or not this program is going to be extended, but we know the CARES Act was extended. So, you know, it seems like there's nothing hard and fast about, I guess, legislative intent at the national level.
Mr. Chairman, Mr. Treasurer, I couldn't agree more. All of this with the ARPA funds and previously the CARES funds, it's a continuum of uncertainty. And I think we go to do the analysis on the information we have now. Certainly, should Congress prefer to extend these deadlines, they certainly could, but that's the information we worked off of.
Yeah, and we can debate the amendment when it comes up. I was going to, Beth, simply because several of these lists have been revised, and I've probably been remiss, but I want to confirm these numbers the treasurer brought up. You know, I think that is our most current list, but I'm just going to routinely make sure that there hasn't been any change. So the amount now allocated for this is $5,100,000. Is that correct?
Mr. Governor, that is correct. This was an entity that we worked with following the last meeting to adjust their request to make it more appropriate for this program.
Thank you, Ms. Blackwell. Anything else you want to add?
I believe if they all kind of run together right now, I apologize. I do believe that their scaled back project addresses the immediate needs, the testing outside, that kind of stuff. I don't know if it changes their completion date. Looking at the current application, the completion date is December of 2025. So I don't know if that's for the complete building or if that's for the parts of the building that they're requesting.
Thank you, Ms. Blackwell. And Mr. Superintendent, did I hear you?
Yes, sir. Just a quick question for Ms. Blackwell or Director Joe Hansen. So does this scale back from 10 million to 5.1 million address the disproportionality issue adequately in your minds?
Understanding
Mr.
this is a
Chairman.
swag.
Yeah. Mr. Chairman, Mr. Superintendent, unfortunately, I feel like that's a board decision that they have to feel like, is this scaled back proportionate? And then also we have to just look at the dollar amount again. Larger dollar amounts, newer projects that will take longer to be completed will by nature receive additional Treasury scrutiny.
But you feel like whether it's addressed the disproportionate issue or not is a board decision?
Honestly, it's the amount of risk the board is willing to accept when they award these grants.
And Mr. Superintendent, I think it, basically a sliding scale, and we we would wrestle with that issue. So
Okay,
I think
and
it's,
then I had a follow-up, Mr.
Yes.
Chairman. I had the same question as the treasurer regarding regarding the issue of continuing harm caused by COVID. 60 to 100 cases, COVID cases every week. That's continuing, correct? That's not in the past. Is that correct, Ms. Kinder?
Ms. Kinder, and I do note that Mr. Nelson also has his hand raised, but Ms. Kinder, I will allow you to answer the superintendent's question. We cannot hear you if you're speaking.
Can you hear me now?
Yep.
So we do typically, we have rounds that we meet every week, and we range, pretty much we follow either above or closely behind Laramie County. But in the last, since October 31st, having 48 cases, then the following week would be 89, 101, dropping down to 46, and then up again to 74. It all fluctuates a lot based on the holidays, weather, but we continue to stay in that above 50 for new cases every week. And those are only the cases that are reported. We know that there are home tests and people are not reporting. So it's a guess, it's a stab in the dark, but those are the ones that are actively reported.
Okay, thank
Thank
you.
you, Ms. Kinder. Mr. Nelson, I see you had your hand up. Mr. Nelson, if you're addressing the board, we can't hear you. I'm going to call one more time, Mr. Nelson. No, there
Thank you,
go.
Mr. Chairman. Can you hear me now?
Yes, we can.
Thank you. I just, in response to a couple of the questions, in reviewing the application, the anticipated end of construction is 12/31/25, which I think gives us a 12-month cushion to the end of 26. And I would just say that that is, the best estimate based on current supply chain issues, which, if that's always subject to change, but we do feel that this project could be completed within the current time restraints imposed by the federal legislation. Secondly, with regard to proportionality, we took the direction from this board and staff very seriously, and in adjusting our request down to the 5.1, we think that that is targeted on those items that are directly COVID related and would, feel that that is proportionate to the risk. So with that, that's all I had. Thank you.
Thank you, Mr. Nelson. Further questions, further comments? Hearing none, we'll move on to 1141, Basic Beginnings Playground Safety Upgrades. And Ms. Blackwell, I see that is $42,250. Is that correct?
Mr. Chairman, that is correct.
Thank you. So looking here in the room, anybody, is there anyone online? Anyone online? I don't see any online. Mr. Johansson, I think in your pinch hitting role, is there any color you want to add to this for the Department of Family Services? Thank you. Okay. One more call, just so we don't miss anybody. Don't see anybody. Okay. Next is 1143, House of Prayer Evangelical Church. Sorry, I can't talk today. True North Academy renovation for $400,000. Ms. Blackwell, is that correct?
Mr. Chairman, that is correct.
Okay. Is there anyone here that would like to address the board? Is there anyone online? Here, online? I see none. Mr. Johansson, is there any color on this that you'd like to add?
Mr. Chairman, I should probably move my seat closer to the mic up here. I'll do that. Just on behalf of the Department of Family Services, in our reviews of this application, Director Schmidt did note that the area of Cody has faced some child care center closures, and this would be a building of capacity there. Both myself and Director Schmidt did recommend funding on this project for additional childcare.
And for clarification too, that it does take general public as well.
Mr. Chairman, that's correct.
So it is just a straight up childcare facility. Okay, thank you. Any comments, questions? Hearing none. Mr. Secretary.
Yeah, thank you, Mr. Chairman. Just a comment on this one here. Let me see, 1143. This real quick here. That one is showing is not showing a match on that one. I don't believe here. And oh no, it does have a match. I apologize, Mr. Chairman. Go ahead.
Okay.
That's all.
Okay, thank you. No further comment, hearing none. We'll move on to 1244, Senior Citizens Council, DBA, The Hub on Smith. The Hub on Smith Expansion Project. And this number the request is $3,007,618. Is that correct, Ms. Sewell? She's indicating yes. Is there anyone that wants to address the board on this project? Mr. Bump, anyone online? Don't see anyone online. Don't see anyone in the audience here. Okay. We'll move on to, I do have Carmen Rideout. Ms. Rideout, I thought you might be online. Thank you. Your floor is yours. If you're talking, we can't hear you. Is there a chance that your microphone might be muted? It doesn't appear that you're.
Can you hear me now?
We sure can.
Great. Thank you so much. Good morning. Thank you for this opportunity. The services senior centers provide throughout the state help people live at home. We help people stay out of hospitals and skilled nursing facilities, which saves the state millions of dollars annually. Especially during COVID, the people that we were serving were most at risk. I'm here today to ask for your approval of our application for funding to expand and complete site improvements that will be a long-term investment in our senior center, which serves over 3,000 people here in Sheridan per year and addresses the harm created and exacerbated by the pandemic. Specifically, we believe this expansion is related to the COVID response in the areas of our home delivered meals. The expansion would add space to this program. During the pandemic, the number of home delivered meals served increased dramatically. Pre-pandemic, we were serving 54,000 meals per year. During the pandemic, we were at almost 90,000 home delivered meals during that year, and it continues to be high at about 75,000 meals per year. So the numbers increased from 150 meals a day to over 400 and have now leveled off to about 300. Space is needed for packaging, storage, increased staff and volunteers. In addition, this expansion would address the entrance for our volunteers who are mostly seniors. And right now they are using our loading dock, which isn't efficient or necessarily compliant with ADA. In addition, the expansion would include a feature of adding more space for our support center, which provides important information and referral services, care coordination, service intake for seniors and their families that are in crisis. And we saw that a lot for sure during the pandemic, and that has continued as well. The support service staff connect people to all of our other services, such as meals, transportation, our adult daycare, our home health agency, and others. The expansion would also increase or provide new space for our loan closet, which provides durable medical equipment. That area has been displaced since the pandemic. And it would also provide space for our dementia support services, which we saw a great need for connecting with those people and their caregivers during the pandemic. The budget for the expansion project is $5,400,000, and we are requesting $3 million. We believe we can get the project completed in the required time, and we are confident we can raise the match funds. So thank you very much. Are there any questions?
Thank you, Ms. Rideout. Are there any questions? Any questions? Any questions? Ms. Rideout, I think there are no questions here. And Mr. Johansson, any comments?
Thank you, Mr. Chairman. I'll just mention, just so I don't get too repetitive and the board's preference for my comments, feel free to articulate. Director Schmidt and I, from the Health and Human Service perspective, reviewed all of these applications on 4 domains. One, does the project respond to the public health, in our view, respond to the public health and mitigate the impacts or harms from COVID? Is it a health and human services provider? And is it a health and human services provider in good standing? And finally, would the director recommend funding of this project? Just for the board's awareness, both directors on this particular application recommended funding for this project.
Thank you. And I would just mention for information that I did tour the project and found it favorable. Madam Auditor.
Mr. Chairman, and I'm struggling to find this on my own. I just want to make sure I have correct information. Carmen, how much CARES Act money did the facility receive?
We received through the city of Sheridan, we received $1.2 million, or actually $2 million for our HVAC project. And then through the aging division, we did receive some CARES funding for services, and I don't have that specific number for you right now.
I'm sorry, how much was the main amount again?
I believe it was about 2.1 million, and that was for our HVAC project during the pandemic.
What I was more or less remembering. Thank you, Mr. Chairman.
Mr. Chairman?
Mr. Superintendent.
So my question is the same as the one earlier related to Natrona County. If they had 54,000, they delivered 54,000 meals per year pre-pandemic, and then during the pandemic, it went up to 90,000 meals per year, and then post-pandemic, it's been 75,000 meals per year. I guess my question is, are all or most of those, or some of those 75,000 meals per year COVID related? Did it not go back down to 54,000 because of COVID?
Ms. Rideout.
It's difficult to say for, specifically, but in general, what we are finding that the people that we are serving that went on home delivered meals during the pandemic have stayed on them for various reasons, whether they're health related or fear of, the anxiety of needing to social distance still. It's hard to pinpoint each one, but in general, yeah, we continue to see people preferring this versus the congregate meal.
So you don't have any hard data on that as
No.
to what is causing it?
Yeah.
But in your professional judgment, you would speculate heightened anxiety by the elderly population related to COVID is a big part of it?
That is a part of it, yes.
So then my question is, does this, does that alone demonstrate that there is continuing harm caused by COVID? And if that's the case, then if that's the case, I would think we'd want to help these folk.
Thank you, Mr. Superintendent. Thank you. Further comment for the question? Any other discussion? I hear none, so I'm going to move on to 1245, Sage Living Long-Term Care Facility, Pandemic Overflow Unit, and Safety Access. And again, Ms. Blackwell or Ms. Sewell, $2,820,843.
That's correct.
That is correct. Okay, thank you. I have a number of hands that are up. Is there anyone in the audience here? Don't see any. I have David Robertson, Anna Olson, Carmen Rideout. Your hand is still up. I don't know if you want to. Okay, so I have David Robertson and Anna Olson. David, Mr. Robertson,
Yeah, Mr. Chairman, I trust that you can hear me.
We can hear you, yes.
Good, thank you, Mr. Chairman, members of the committee. My name is David Robertson. I'm the CEO of St. John's Health. If it's appropriate, I would like to address both project numbers 1245 and 1250. 1245 is the Sage Living Pandemic Overflow Unit and Safety Access Project. Sage Living is a new long-term care facility that we built on the St. John's campus in Jackson. It opened in 2021. And as a part of that project, we constructed a 16-bed intermediate inpatient rehabilitation facility. That 16-bed unit is what is called a distinct part unit, which means that its bed complement is not included in the 48 beds of St. John's Hospital. Sage Living, including the inpatient rehab facility, is a freestanding building on our campus. This project is a project that is intended to be a proactive effort to be positioned to better handle future pandemics and future crisis situations like we have seen over the last 2 years. The inpatient rehab facility has 16 private rooms that are, absolutely inpatient patient rooms. But because it is not directly connected to the hospital, it was not possible for us to use those during the pandemic. And so the notion of this project is to create an underground connector corridor that would allow during future pandemics for these rooms to be used really as a distinct part pandemic unit, separating the pandemic unit from the remainder of the hospital, so that it is really a dedicated unit. It is a matter of enhanced safety for the community, enhanced safety for staff, and enhanced safety for other patients that are in the hospital, while at the same time expanding our capacity to deal with these crisis situations. So this project, really is a proactive approach to be able to better meet the community's needs, particularly a community that sees surges in population during certain times of the year due to tourism. Project 1250, the on-call housing project, is to is one of a multitude of projects that we are looking at to try to deal with the extreme housing shortage situation that we are experiencing in Teton County that makes staffing of St. John's extraordinarily difficult. In fact, I have been a hospital CEO for over 32 years of my career, and also I spent 10 years consulting with hospitals all across the country. And I can tell you that the housing and staffing situation that we are experiencing in Teton County is the most daunting and the greatest existential threat to any healthcare facility that I have ever worked with. Because of the extraordinary cost of housing in Teton County, housing is virtually unaffordable for our staff. It's impossible from a home ownership standpoint. And today in Teton County, a 2-bedroom apartment, the free market rental rate is $4,200 a month. For healthcare workers, housing in Teton County is just unattainable. So what we are finding is we are having to recruit and entice healthcare workers from much farther distances to commute to Teton County. We are recruiting heavily out of the state of Idaho. But in order for people to be able to live 50, 75, 100 miles away and commute to work, in order to, when they are on call, we have to have rooms for them to stay in so that they are in close proximity to St. John's for emergency reasons. And so this project is taking rooms in our old living center, which was the nursing home that predated Stage Living, and converting those into on-call short-term living rooms for staff. So this is, as I said, this is one of a number of initiatives that we have on our slate to try to address this housing crisis that we are faced with. You all have not looked at dropping project 1226 from the agenda. That is another initiative to deal with housing. We clearly, I want to acknowledge the fact that we clearly recognize that there are lots of worthwhile projects and limited funds. And so, you know, I certainly want to say of these two projects that are being considered for elimination, internally, we prioritize 1250, our housing project, above 1245. So while we would hope that both of these projects would be considered, if you would be open to carrying only one forward, we would ask that that be 1250. And I would be happy to address any questions that you all have.
Thank you, Mr. Robertson. Are there any questions? There are no questions for Mr. Robertson.
I have a question, Mr. Chairman.
Mr. Superintendent. And Ms. Olson, you're on deck, so go ahead, Mr.
Okay. Mr. Robertson, I was trying to track, I couldn't hear everything you were saying, but regarding the application 1250, can you or have you demonstrated a direct connection between COVID and the Teton County housing shortage?
Absolutely. With the advent of the pandemic, The number of people from out of state that have moved to Jackson and eliminated the inventory of housing have driven the cost of housing up has been dramatic. There are virtually zero vacancy rates for rental housing in the community. As I have said, with the pandemic and the doubling of housing costs, housing pre-pandemic was virtually out of reach of most local workers. It is completely out of reach today. We have also seen the loss of our employees grow dramatically, and our vacancy rates and loss of employees grow dramatically because of the cost of housing and the unaffordability of housing. So absolutely, we can tie those directly.
And then a quick follow-up, Mr. Chairman, on application 1245, the Sage Living one. Sir, am I understanding it right that that would be more of a proactive project? In fact, I think I even heard you phrase it that way, as opposed to a response to the applicant's current COVID needs? Is that fair and accurate?
Yes, it is a proactive project. It is, we are not able to use that space today for COVID because of the fact that it is a freestanding facility not connected to the rest of the hospital. And so to be able to provide emergent response and transport of patients to other areas of the hospital needed for emergent response, it is not available. So this absolutely is a proactive project.
So it would be in preparation for future pandemics?
Yes.
Okay, thank you, sir.
Thank you,
You're
Mr. Supervisor. Further questions? Hearing none. Ms. Olson.
Thank you and good morning, Governor Gordon, Mr. Chairman. Can you hear me?
Yes, we can.
Great, thank you. And thank you, members of the committee. This is Anna Olson. I now have the pleasure of being the president of St. John's Health Foundation, the nonprofit arm of St. John's Health here in Teton County. I've had the pleasure of working with you in the past as the president of the Jackson Hole Chamber of Commerce. That was a role I had during the pandemic, and I'd like to just take my little public comment back to 2020, 2021, and remind you of the impacts of the pandemic on Teton County. In Yellowstone, we saw an increase of 28% of visitation, which directly arrived, thankfully, for many reasons at that time, for economic value into Teton County. The visitation numbers continued to soar. We saw a 55% increase in state and local taxes collected. The impact on Teton County of a pandemic, and clearly not all pandemics will be the same, was swift and was enormous. Translating that to the impact on the hospital really underscores the importance of these projects. And as to just address the last comment about the impact of housing, in April of 2022, the median house price in Teton County was over $4 million. Now, full transparency, that number has come down a little bit after this fall, but we are still in an environment where our workforce cannot afford housing here. Moving from general workforce at the chamber into professional workforce that a hospital requires, and the physicians through to the nursing, through to other service providers within the hospital, we are looking at an environment where they need to be living locally. As our CEO, Mr. Robinson, committed. And so the idea that building and having the ability to have these isolated beds above and beyond what our normal census or bed count is critically important for this pandemic situation we're discussing this morning. And obviously the spending of the ARPA funds need to be directly tied. And I truly believe these two projects are in response to our geographic and business environment in Teton County, as much as our needs for serving our community. And I'll leave it at that. Thank you so much for your time today. I know it's going to be a long and difficult day.
Thank you, Ms. Olson. Any questions from Ms. Olson? Hearing none, Director Johansson, no comments. So that has brought us to the end of the list. And we've heard from each of the applicants. Mr. Treasurer, Mr. Superintendent, it appeared you had a couple of considerations you wanted to look at. If this would be the time that amendments might be in order.
Thank you, Mr. Chairman. I would move that we remove from the do not consider list and place the Natrona County Health Department 1087. I'm not putting a dollar figure on that because, as we all well know, that as we put ones on, we're going to have to find the money and or try to attempt to find as much as we can. And so I'm not going to put a dollar figure on that, Mr. Chairman.
And Mr. Treasurer, just sort of making sure that we're all in order. The motion is to deny funding. Your amendment is to remove the item from the deny funding list. So,
correct, Mr. Chairman.
Okay, thank you.
Mr. Chairman, I would second that.
Okay, that motion has been moved and seconded. Any discussion? All in favor signify by saying aye.
Aye.
Any nays?
Nay.
One nay. Two nays? 2 and 2, is that correct? Thank you. Okay, I will be an aye on that. So that motion does carry. Are there further motions? Are there further motions? Are there further motions?
Mr. Chairman, I would make a motion to amend to remove 1244 from the no list and not putting a dollar amount on that, the Hub Smith expansion.
Okay. Same clarification. Thank you, Mr. Superintendent. Is there support for the superintendent's motion?
I would second, Mr. Chairman.
Okay, that motion's been moved and seconded. Item number 1244 is removed from the motion to deny funding. Is there further discussion? Further discussion?
Mr. Chairman, do we need to vote on
But what I'm saying is that that motion is on the table, and I'm asking once again for any discussion. Hearing none, all in favor of the motion, of the amendment to the motion?
Aye.
Aye.
There are two ayes. Are there nays?
No.
There are 2 nays. Thanks again. I will be an aye. That motion carries. We now have an amended motion on the table, and I'll see if I can go through this correctly. Item number 1021, Memorial Hospital of Sheridan County supply chain relocation. Item 1023, Memorial Hospital of Sheridan County HVAC completion for 20 additional private multi-use reverse isolation rooms. Item number 1039, Memorial Hospital of Sweetwater County Medical Office Building renovation. Item 1042, the Thayer Senior Center Lower Valley Human Services Facility. Item 1141, Basic Beginnings. Item 1143, House of Prayer Evangelical Church, DBA True North Academy, True North Academy renovation. Item 1245, Sage Living Long-Term Care Facility, Pandemic Overflow. And item 1250, Teton County Hospital District, DBA St. John's Health. Those items are still contained in the motion. Is that the proper? Okay. Are there further amendments to be made to the motion? Are there further amendments? Further amendments? Hearing none, we'll vote on the main motion. Is there any discussion on the main motion? Any discussion? Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Nays? That motion carries. Thank you, all of you, for being here. Mr. McCafferty, I see you have your hand raised. You don't? Okay, thank you.
We had on there. Well, we didn't have any numbers.
I want to thank everyone for being here. These are difficult choices, and I know I want to recognize the staff's work, but I also especially want to recognize the applicant's work. And I know this is a lot of work. Those projects, according to the motion, are denied. So, back on course of action. What's our Mr. Secretary?
Mr. Chairman, like I say, I just want to be clear. All of these are really good, and I wish we could do them all, but we can't. And there is limits to what we can do. So, in those that we vote not to fund, it's nothing there. But we do have to look at trying to get the best we can across the entire state. With that, there was a couple I missed, but I would like to make a motion on 1127 Southwest Counseling Service, the Jonah, that we do not fund that one.
Okay. Mr. Secretary has moved that 1127 have a do not fund. Is there support for his motion?
Second, Mr. Chairman.
It's been seconded by the auditor.
Mr. Chairman?
Mr. Treasurer.
Point of information, is this the one that had, was put together kind of in like three different deals? And is this funding all three of them? Just to kind of
Let her answer.
get me on speed.
Ms. Blackwell.
Mr. Chairman, Mr. Treasurer, we funded 3 of these Southwest Counseling applications at the previous meeting. This was the last one to be considered.
Okay, thank you, Mr. Chairman.
Thank you, Mr. Chair. Mr. Secretary, did you have any?
Yeah, thank you, Mr. Chairman. My comments on that, the reason for that is, as Ms. Blackwell said, we funded 3 out of the 4. And this one here in their application, they even refer to it as mothball building. But I do think that we've got 3 out of the 4 for them. And so to spread some of this around somewhere, I think that we need to give some opportunity to some others. So that's why the motion to not fund this one.
Mr. Secretary, thank you. And in accordance with a practice that we're going to observe today, is there anyone from Southwest Counseling Service, Jonah Treatment Facility for Crisis Stabilization, Mental Health and Substance Abuse Residential Treatment for Women, project for $935,646? Is that correct, Ms. Sewell? Thank you. Is there anyone that wishes to address the board? Anyone? Anyone? Do not see any hands raised? Oh, Sorry. Oh, please. All right. Ms. Aker is at the top of the list. Her microphone is muted. It is now unmuted. Ms. Aker.
Yes, Mr. Chairman and board members, my name is Linda Aker from Southwest Counseling Service in Sweetwater County. The Jonah project is the #1 priority for Southwest Counseling Service. We had 4 projects total. The Jonah project has a little bit of a history with us that I'd like to just take a few moments to inform the board of. That was a donated building to Sweetwater County from the Jonah field. It's a 4,000 square foot building. And prior to it being able to be moved from the Jonah field to Sweetwater County, of course, we had to have an inspection of it, that it was structurally sound and it would meet the health codes and building codes of Rock Springs. And we knew at that time that Southwest Counseling was becoming very limited in space, very limited in our capacity, because where we provide anywhere from 175 to 250 people coming through our Foothill facility, we knew that we were going to have to do something, and the Jonah donation was a great opportunity since we had the land to put it on. Well, our timing was a little bit off because Southwest Counseling has to save money in order to expend it on capital projects. And so the pandemic happened in March of 20. My board decided in November of 20 that we would proceed with the bids and we would honor the bids. And we have that building right now on a foundation. We've done substantial work to it. And the primary reason for wanting that facility to be operational is because it's a safety and a public health risk for people to be in group settings or individual settings without adequate spacing today. We know how important adequate spacing is for everyone, but this was our #1 project. And I would just have the board all 4 projects together, I think at a 50% match would have been $1.3 million. It would be over. It would be $1,333,095.50. So if the board could reconsider, I know there's 4 projects, but really Jonah is the #1 because of the public health safety issue and the spacing. Our demand has increased. It has not decreased since the pandemic. Last year alone, we provided over 60,000 direct service hours in Sweetwater County. Now, Zoom is remarkable. It provides me to be able to talk to you today. We can do Zoom by with our clients, but there's no replacement for face-to-face, especially in a therapeutic modality. So I would entertain any questions from you. I greatly appreciate what you've already done for our community, and I know it's very hard work.
Thank you, Ms. Aker. Are there questions for Ms. Aker? Questions? Mr. Treasurer.
The amount that we've already given to them, that would not preclude them value engineering and using that money for this building. I don't think that we're required to if we give them $1 million and they only spend 800,000, they don't have to return it to us. That's what I'm trying to get to. No reversion.
Mr. Chairman.
Yes, thank you, Mr. Miller.
Thank you, Mr. Chairman, Mr. Treasurer. They would only be able to spend that money on the projects that have been approved by the board. So if the board's pleasure is to allow them to go forward on this project, I would propose that the board adopt a motion, something along these lines. I move that the board approve the Jonah project, but does not allocate additional funding to Southwest Counseling, and further directs the Office of State Lands and Investments to work with Southwest Counseling to allow them to allocate funding across their 4 projects based on what was already awarded.
Okay, thank you, Mr. Treasurer. Thank you, Mr. Miller. And-
Keep that in the can.
Okay, thank you. Further questions? Further questions? Hearing none, what is the pleasure of the board? I guess you did move that. It has been supported, so is there any discussion?
Mr. Chairman,
Yes, Madam Auditor.
I was the seconder on that motion, was I not?
You were.
I would either see if we could amend to that abridged language, so a no funding motion. However, so in a motion with no additional funding, but allowing them to add a little bit of flexibility amongst their projects, if the motion maker is okay with that. And if not, I will maybe do something else.
So I would allow the motion maker to reconsider how he states that, and then we'll have a second. Or alternatively, we can let the treasurer make the motion to amend.
You can withdraw or amend.
Mr. Chairman, I believe that if I've got this right, Ms. Auditor, that we would change that motion to approve Jonah with no funding, but that they would be able to take the previously approved funding and work with Osley as far as prioritizing amongst the 4
And
what they
reallocating.
want with already approved funding.
And reallocating.
Reallocate.
So is that motion is your motion now, as you've restated it?
Yes, Mr. Chairman.
Okay, and
That was
Madam
a great
Auditor?
restated motion. I will second
Yeah,
that.
so that, okay, thank you. Is there any further discussion? Further discussion? Further discussion? All in favor signify by saying aye.
Aye.
Nays? That motion carries. Next matter. We can get to the point of stepping down through projects if that is the preference of the board, or if there are other motions that are pending that people have in mind, please feel free.
Mr. Chairman?
Mr. Treasurer.
Could we have a little time maybe to work with staff and do the math on here to find out how many of these that I think we're overspent, but I don't know. I know Carl's got a spreadsheet. I don't know whether he can do that or you guys can, just so we know. Because we're gonna have to probably do some haircuts if we're gonna provide, or we could go all the way through and leave the door open to go back in and either do the haircuts or leave the funding open, approve them with funding to be determined later, or however you want to move, Mr. Chairman. I just don't want to leave something at the end that we want to do, but we've blocked all capabilities of any kind of a proportional funding or any funding.
Okay, thank you, Mr. Treasurer. Is there further discussion or further action to be considered?
Mr. Chairman, I would actually like to make a funding motion, but I don't know if that's ripe yet. And again, we haven't spent anything yet
Right.
today,
Yeah,
so as far as our balances go and where we're at, and just, and this is something I wanted to speak to a little bit. Everybody here and online is, as they should be, such an advocate for their project, and they don't necessarily know what the entire population is. So just so we have some clarity there, we are still, at the beginning of today, we were looking at 100 and $19 million of open requests still, with 51 million to fund. So just based on math, the majority of people will leave with either less or less funding than they requested or no funding. And we can move the deck chairs around all day. That doesn't change anything, unfortunately. Now, we have already chosen, to not fund about 17 million projects on that list. So we're getting down to more or less about half, about one half. We have about 2 times the amount of requests. But Mr. Chairman, would it be appropriate now to perhaps start making some positive funding recommendations, or I can wait if you prefer?
Yeah, that would be, I think, fine.
And Mr. Chairman, I recognize that we are taking these not necessarily in the order they were published, but why start now?
A very good question.
So, Mr. Chairman, I would first move a positive funding for project 1019 in the amount of $2,269,125, and that is to North Lincoln County Hospital, doing business as Star Valley Health and their emergency department addition up there.
Is there support for the motion?
Second.
It's been seconded by the superintendent. Is there any discussion?
Mr. Chairman, this is less than what they originally requested, I think, wasn't it? Or is this the full amount? I thought it was substantially less.
Mr. Secretary, it seemed you had a comment to make on that.
Yep. Thank you, Mr. Chairman. And we do have somebody here from there to speak on that. But I did want to say that, I went through and looked at this one, went toward that. And there's a lot of impressive things on this. First off, it already is an existing building. And what this does is this fills in with the emergency department there. The effort that Star Valley Health has put on this, I think, is commendable, and I would be in full support of this.
Okay, I thought you might know if it was fully funded, but Ms. Sewell, not Ms. Sewell, Ms. Blackwell.
Mr. Chairman, the original application that was submitted was requesting $3,540,000. $363.
Okay, so this is for less, to answer the
Okay.
Thank you, Mr. Treasurer. Nope,
Good.
Is there someone here from Star Valley, North Lincoln to address? Yes, there you are. Come on up, and if you can identify yourself in the microphone, and you have the board's full attention.
Thank you, Mr. Chairman, board members. Appreciate the opportunity to make a few comments. Star Valley Health.
And you'll need to identify yourself.
Oh, pardon me. Mike Hunsaker, Chief Operating Officer for Star Valley Health. Thank you for this opportunity. I appreciate the board's consideration of our request today. As was mentioned, we did reduce our funding request from 3.54 million down to 2.269 million. We feel like our application meets the requirements of the guidelines for the funding. Our hope is to provide for increased access to healthcare services to our community in Alpine, Wyoming, where there is a lack of access. That community is a minimum of 35 miles from any hospital facility where there is an emergency room, testing capabilities, as well as our plans also include a psychiatric hold, behavioral health hold room for our emergency department that would allow our behavioral health services team to provide services to the community that in Alpine that does need behavioral health services in that manner. I'd be happy to answer any questions the board may have at this time.
Thank you, Mr. Hunsaker. Any questions? Any questions? Any comments? Director?
Thank you, Mr. Chairman, members of the board. Just a quick note, as Director of the Health Department, I did recommend funding for this project.
Thank you very much. Further questions? Further comments? Let's move to the vote. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Congratulations.
Thank you very much.
Thank you.
Mr. Chairman,
Yes, Madam Auditor.
if I may, I think I'd like to maybe get one out of the way and down the road. If it's appropriate, I would move for full funding of $10 million to the Sublette County Hospital. And Mr. Chairman, I think there'd been some discussion of giving this a haircut, and I was tempted by that as well. So I reached out to some folks last night and said, you know, can you do with less? And then I said that, you know, and they said, we really can't. And I went through the, you know, no, really, can we reduce it? You know, where are you at? Where are you sitting? And I found out even with this 10 million, they will likely have to go back to the county and get even more money. So that's my reasoning for the amount and not reducing it. So I hope there'll be support for that. And Mr. Chairman, I know we all know the rest. This is the only county that doesn't have a hospital there. They are place bound. They are certainly limited by transportation and roads. And I think this week, more than anything, has taught us that, you know, a hospital may be 60 miles away, and that may not sound that bad, but it doesn't matter if you can't get there. It doesn't matter if the roads are closed. And so I know that we will hear from them as well, and they will be more articulate than I. So that's my motion, and I hope I have support for it.
Thank you, Madam Auditor. Is there support?
I would second it, Mr. Chairman.
Thank you, Mr. Superintendent. The motion's been made and seconded. Are there any additional comments from the staff on this? I would add one quick comment to this, and that is, you know, we did look at this project last time around, and we just to remind us that there is a USDA loan that is also contingent. So with that, let me ask anyone to come up and address the board. Yep, thanks.
I'm the administrator for Suffolk County Health.
Thank you. Thank you,
And
Mr.
we appreciate the opportunity to present today. I would like to remind everybody that we do have other people in support in the audience today. We've got Representative Albert Summers, Mike Hunziker for the CEO of Star Valley, Carrie DeWitt, Public Relations Director. On Zoom, we have Dave Bell, Board Trustee, Sam White, County Commissioner, Brenda Allen, USDA, and Lorraine Werner, USDA, and also Glenn Pauley from the USDA is here as well to support our application. As you guys said, we are the only county in the state that does not have a hospital. Our project includes a critical access hospital and a long-term care facility. This project is critical to providing COVID-related healthcare services to our community. We do have community support. In 2020, we went to the Sublette County voters, and they passed the formation of a hospital district, which raised the taxes by one mil. We also have the support from all the mayors in the county and the Sublette County commissioners. I wanted to highlight the county commissioners' commitment to the project. They have committed $20 million to the project, and we recently have signed a transfer agreement with them that transferred the ownership of the clinics and EMS buildings in both Marlton and Big Piney. The value on that property is approximately $40 million. They also gave us $1.3 million to put towards the land that we purchased for the project. So all in, the Sublette County Commissioners have put in around $61 million towards our project. As indicated, we did apply for USDA funding, which was approved in June of 2022 for $32 million. I also just wanted to remind everybody that we do have a very effective management agreement with Star Valley Health. As you know, Star Valley is a successful critical access hospital with an attached long-term care facility. This partnership provides us with the expertise to make a successful project. In 2020, we were planning our facilities when COVID hit, and that's why we're here today. The new realities of the pandemic required changes to our plans. As we were totally dependent on surrounding hospital to care for Sblc County COVID patients, we watched and learned, and we changed our plans and added square footage to address COVID. In the hospital, we added entrances to separate patients and staff with the goal of keeping both patients and employees safe. We added a trauma bay, additional exam rooms, a sick waiting room, upgraded HVAC systems, additional inpatient rooms to address COVID. We also included 2 Title 25 secure isolation rooms to address COVID mental health issues. Also, on the nursing home side of the project, we learned valuable lessons through the pandemic. We increased the square footage to allow for the maximum number of private rooms to reduce the spread of the virus. We added common spaces in case there are partial shutdowns. And we also added a COVID patio for relatives to visit if there's a total lockdown. As our facility grew, so did our costs. This is why we're making this ARPA grant application. Both the increased costs due to COVID and inflation has made this $10 million grant critical to our project. In closing, I'd just like to thank you guys again for the opportunity to present, and I'm glad to answer any questions you might have.
Yeah.
Thank you, Mr. Dorn. Mr. Treasurer.
I got a list here, so you might grab your pen.
Okay.
What's the total cost of this all in, regardless of the funding source?
Total cost all in, right now, we're at about $76 million.
76 million. Okay, so you're looking at 10 million of 76 that you're attributing to COVID.
Right.
Okay.
Correct.
What's the maximum amount that the USDA would loan? They're loaning 32.
30.
What is the maximum amount?
That is the maximum amount.
That is the maximum amount.
Yes.
Okay. What do you get on 1 mil of tax?
What do we get on 1 mil of tax? Right now, today, I think it's $2.5 million.
2.5 million. Okay.
We also have the 20 million committed by the county too, to throw into that mix.
Right.
Okay.
Right. Yeah. Okay. Well, thank you. I'll do a little bit of math here. Appreciate it.
Okay. Yeah, we're still coming up a little bit short, so we've still got some work to do.
Yeah, thank you. Thank you, Mr. Treasurer. Further questions for Mr. Dorn?
Mr. Chairman,
Madam Auditor.
are you going to be doing any telehealth related services in the new hospital?
Yes, we do.
Can
We
you
do.
talk to me a little bit about that?
Well, right now, obviously, we provide some of those services right now. Having the hospital will increase those capabilities because we'll have more services to offer. But yeah, we're offering options to our patients to try to eliminate the travel. I mean, obviously, one of our main goals to this project is to try to keep Sblc County residents off the road, getting healthcare in other places. And so we are promoting that services.
Thank you.
One follow-up, Mr. Chairman. I know this is a stretch, but you don't happen to have any sort of dollar figure associated with telehealth capabilities?
I do not. Not right on top of my head. No, I do not.
Follow up, Mr. Chairman.
Mr. Treasurer.
Yeah. How much did you say the land that was donated, and that's it, that the 20 million is cash from the county, right? Not
Yep, that's
land?
cash. Yep.
And how much was the land valued at?
The county commissioners gave us $1.3 million to put towards the purchase of our land.
Yeah.
Yes.
Okay, I'm trying to look at the in-kind because I got. So is that?
The value of the land, the total cost of the land was 2.7 million.
Is that in the 76 million?
The 1.3 is that the portion, our portion of that purchase is in the 76 million.
It's in
Yes.
76 million.
Yes, it is.
Okay, because you've got 24 million, I guess, that's out there. And you're gonna, I guess, cash flow that with profit in the 1 mil.
Well, yeah, I mean, what we have is we have 32. We have $2 million that we're going to kick into the project to make that 34. We've got 20 coming from the commissioners, which makes that 54. Hopefully we have 10 coming from you.
from the ARPA grant that gets us to 64. And so that puts us in that 10 ballpark short that we need to raise and or go back to the county for.
Yeah, but that 1 mil tax, is it on for a specific time, or is it?
No, that's ongoing, and it's all
It's
based
ongoing.
on county valuation, price of natural gas, price of oil, yes.
Yeah, okay, thank you, Mr. Chairman.
Thank you, Mr. Treasurer. Mr. Dorn, let me ask if there are any other questions. If not, you had a pretty long list of folks to testify, and I want to be mindful of everyone's time on that. So I'm going to ask if you want to, I do see President Dockstetter on. If you can kind of talk to some of the people, I'd like to try to have everybody have a chance to speak, but I do want to try to keep us on track, so I might limit some of the time.
You bet. You bet.
Okay, thank you. Mr. President, while Mr. Dorn's kind of getting his troops rallied here, I want to recognize you.
Will do. Thank you. Can you hear me?
We can.
Yes. Thank you very much for this time. All I have to say is I bring you a proven healthcare company that will serve Pinedale well. In your previous decision with Alpine's the same way. These folks at Star Valley Health understand and know and are successful at rural healthcare. And sir, you've heard me say that multiple times in your office in our early morning meetings. They already know how to do it. So feel confident as you move forward with both the Pinedale Sblc project and the Alpine project. Thank you, sir. Thank you, committee.
Thank you, Mr. President. Who next would like to address the board? I would have recognized the good representative, but he indicated you should come up first, so no, go ahead. Okay,
Thank you, Albert. My name's Carrie DeWitt. I'm the Public Relations Director for the hospital district, and I can be very brief. We are the only county without a hospital, which means we lack blood transfusions and chemo and just basic services. There is so much of our community on Zoom right now watching this, and it's going to be a game changer for our community. So I can't thank you enough for your support. I really appreciate it.
Ms. DeWitt, thank you very, very much. And thanks for showing, probably many of us, but I know for my tour of the facility, thank you very much.
Thank you. Appreciate it.
Representative.
Mr. Chairman, thank you, and I appreciate the time. I just remember as a small child with asthma, going down the canyon to Jackson, trying to struggle for breath. And so from a personal experience, I think it's really important to have a hospital in our county to take care of our people and our children. Thank you.
Thank you, Representative. Others, please come up. I can't remember your name, so I apologize, but I really appreciate the fact that you're here.
Okay.
Thank you.
Mr. Chairman and other members of the council, my name is Glenn Pauley. I'm the state director for USDA. I actually cannot lobby for an individual project. I just wanted to remind people of our underwriting process, that we do a very thorough analysis of the need in the community to make sure that the hospital is going to meet the need, to make sure that there's public support for the hospital, and also to make sure that there's a long-term plan for financing the hospital. And we did approve a loan contingent upon the other sources of funding that they mentioned in the application.
Thank you. And just while you're here, Ms. Raleigh, that's the same case as with Riverton Hospital as well, is that not?
Correct.
Yeah, thank you.
Mr. Chairman, a question, please.
Yeah.
The 32 million, when you underwrite, we've got, some $2.5 million free cash flow with a 1 mil. Did that come into consideration when you looked at the 32 million?
Mr. Chairman, I have our program director from the community facilities on the phone, Brenda Allen. She will be able to answer that question as far as the details of that.
Thank you very much.
Okay. Thanks. Please come on up.
Mr. Chairman,
Mr.
thank you. Mike
Hunsaker.
Hunsaker, Star Valley Health, Chief Operating Officer. I would just take one moment and reiterate the commitment that Star Valley Health has to work with the Sublette County Hospital District in building the hospital and achieving critical access hospital status as part of this project. We're proud to work with the folks in the county to make sure that this can happen. Thank you.
Thank you. Thank you, Mr. Hunsaker. Are there others? Thank you.
Mr. Chairman.
I have
Sorry.
Mr. Bell, but go ahead, Madam Auditor.
I'll do mine at the end, honey.
Okay, so Ms. Allen, I think you were called out, and then I'll go to Mr. Bell.
Mr. Chairman, can you hear me?
We can.
Yes. In our underwriting procedures, we did look at all the funding and all the numbers to make them work.
So follow up, Mr. Chairman?
Yes.
What's the term of that $32 million loan?
I believe it's 35 years.
35 years.
I can check in just a second.
Was the 32 million something that was asked, or the maximum amount that you guys derived based on your underwriting?
That's the number we basically derived on making sure that they were sustainable and the underwriting, what they could afford.
Okay, thank you.
Thanks. So Mr. Bell, I recognize you.
Good morning, Mr. Chairman and members of the board. Appreciate the opportunity to address you this morning. I presume you can hear me.
We can.
My name is Dave Bell. I'm an elected member of the Hospital District Board of Trustees. I appreciate your consideration of our project. I know we have a great team that's in front of you directly. I'm sorry I could not make the trip to Cheyenne yesterday because of some other commitments. We are doing I think to speak a little bit about the deficit that we're facing. We're doing a significant amount of value engineering on the project right now. We had a construction meeting this morning with our contractor, architect, and some of our subs working on ways to save money. In today's construction environment, I'm sure all of you are aware, 30–40% project cost overruns over engineers' original estimates is not uncommon. That's why it's so important that we are really working hard on how we can bring these costs down. I can assure you that we're going to get there. It's just a bit of a challenge at this point, but we've got a great team between Davis Partners, our architects, Leighton Construction is our general contractor, and a bunch of great subs. So we are very aware of your concerns about costs, and but this $10 million funding request is very important to the ultimate outcome of our project. So happy to answer any questions about the kinds of things we're doing on value engineering, as well as any other questions that you might have regarding the project. I do appreciate your time and allowing me to speak directly to you. Thank you.
Thank you, Mr. Bell. Questions for Mr. Bell? Hearing none.
Mr. Chairman.
Madam Auditor.
Not to disrupt the inertia we have going, I would actually like to amend my motion if my seconder is okay with that. And my thought would be to take $500,000 from the telehealth pot and $9.5 million from the general pot instead of my original motion, which was $10 million from our general pot.
Okay, so that motion has been made. Is there a second?
Yes, sir, I would second that.
And motion hasn't been made, it's been amended, and the seconder accepts that. So that is the motion that is on the table. Thank you. Further comments, further questions?
I forgot to ask what the interest rate was on that $32 million loan.
So, Mr. Dorn.
Somebody knows that.
We snuck in with a 2.5% interest rate, which is really great.
Yeah. Thank you. Further questions, further comments? Do you want to address this, Mr. Director? You don't? It's not that you don't have an interest, it's just that you think the issue's been brought. I take it, okay. Can I ask one more time for discussion? Hearing none, all in favor signify by saying aye.
Aye.
Nays?
Nay.
That motion carries with treasurer voting nay.
Mr. Chairman.
Mr. Secretary.
I think we can get one more in there before we take a break. I would like to move item number 1035, China Health and Wellness Center, DBA HealthWorks, 6,200,000, 133 in the rural health.
Second, Mr. Chairman.
Okay, that's been moved and seconded. Is there any discussion? Anybody want to come up and address the board on this?
Good morning. Can you hear me?
Yes, we can.
Good. Good morning, Chairman. I'm Tracy Brocious. I'm the CEO of HealthWorks, and I am here along with several members of my staff and several of my board members. We're here to represent not only the staff, but also our patients today. So HealthWorks is a nonprofit community health center that serves predominantly Laramie, Goshen, and Platte counties. And each year we provide over 13,000 medical, dental, behavioral health, and pharmacy services. We foster the health of our community by serving everyone, and including the underinsured and uninsured patients of all ages on our sliding fee scale. So 48% of our patients come from either a rural or a medically underserved area. So we have requested funding to purchase a new building and renovate it into a clinic with sufficient HVAC that will be able to serve our patients for the next several decades. Currently, we are unable to upgrade our HVAC. Our staff and patients continue to wear masks to stay safe. And from words from our engineer, the HealthWorks building was designed with only basic temperature control functionality. It is a very simple metal building, and it is, in my opinion, that the existing facility does not have the capability to accept a new mechanical system that would be needed to meet the ventilation requirements required by the CDC. The challenge is the building itself cannot be sealed tight enough to create the negative pressure that is required for healthcare settings. So as a community health center for over 20 years, our financial payment model is very stable. We have built our capital reserves and now have 7 potential local banking partners ready to help us launch this project. And the capital construction funds we have requested will allow us to move immediately to construction. And we expect to be finished by 2024 and serving patients in a new location. So that is our ask. And I really wanted to just talk a little bit about a couple stories. And so I'm going to share that, like many of your families, my great-grandparents homesteaded here in Wyoming, and often when the wind blows like it has the last several days, I wonder why. Because life in Wyoming is very hard. My family didn't come from money. They lost their homestead, they moved to town, they made it work, and they rarely asked for help. And they could have been my patients in our clinic. So recently, my 83-year-old aunt shared a story from her childhood in the 40s. She remembers that my grandfather was out of work, and one day a big box of food was delivered by the neighbor lady. My aunt was so excited because there was a box of cereal and a big box of donuts in that box. She was so excited and jumping for joy when she turned around to see my grandmother crying. She was like, why is she crying? There are donuts, right? It wasn't until much later in her life that she realized that she was crying. My grandmother was crying because the neighbors recognized that they couldn't feed their children. They were hardworking, poor, and could have been my patients. But neighbors take care of each other, and Wyomingites take care of each other. And so that's really the foundation of our clinic. 30 years ago, a small group of local retired and volunteer doctors and nurses started a free health clinic in Laramie County. They could see the poor and vulnerable not getting basic primary care and pharmacy services. They turned their passion for service into an application to start HealthWorks as a federally qualified health center, which is the funding that we used to build the building that we have and are currently located in. So now 20 years later, we continue to serve every patient that walks through the door and needs our services. We continue to treat the vulnerable and those who often do not have a support system of their own. HealthWorks treated and tested the first COVID patient in Laramie County. One of our patients was also the first death in Laramie County, which very much affected the staff. So the staff was innovative in the early months of how to keep themselves and our patients safe as possible. Because our building, again, the HVAC is designed for basic heating and cooling and doesn't meet the CDC guidelines for air exchange. So the staff dug in, they put on their coats, their boots, goggles, face shields, N95s, and they treat patients in the parking lot, in the snow, in their cars, despite the wind. So we acknowledge that our request is big, but so is the ongoing harm to my staff and my patients. Our numbers, our patient numbers keep increasing due to the economic challenges facing our patients in Wyoming. And we continue to treat COVID every single day. We are now also seeing 3 times the number of mental health patients in the clinic than we did before COVID. Our providers are treating complex grief, trauma, and just the stress that COVID has compounded in their lives. The challenge is that I can hire more staff to treat those patients, but unfortunately the wait list grows every day because I have no more space to hire and treat patients. I just physically do not have any more space. So the vulnerable population doesn't ask for help, so I'm here on their behalf. I'm here to ask for the funding to build a place where we can care for them. And sorry, but I can care for my staff. They are very important. So I'm not asking for that box of donuts that my aunt was so excited about. I'm asking for the box of kindness that my grandmother received. And I'm sorry, I've practiced this over and over so I wouldn't do this. Because Wyomingites take care of each other. So please let me take care of the next 40 years of patients that need us. This funding can do that. Thank you. And I promise I can answer questions.
Yeah, thank you very much for your comment and support. Madam Auditor.
Mr. Chairman, now just to be clear, you're not affiliated or owned by or in cahoots with the hospital?
No, we are an independent nonprofit 501c3. We do receive some funding from the hospital as a support for diverting ED visits. And every COVID patient that we treated in our COVID room was considered a diverted emergency room visit.
Mr. Chairman?
Mr. Treasurer.
Are you eligible for Medicare and Medicare payments?
Yes, we do. Okay. And actually, we receive an enhanced Medicare and Medicaid payment, which helps keep us very sustainable.
Thank you. Further questions?
Mr. Chairman,
Madam
I don't want to
Auditor.
call them out, but could you identify your board members that are in the room?
Yeah.
Yeah, I wondered why he was here. That's all.
Yeah.
Wow, nothing escapes this woman's gaze.
I know.
No, thank you. Further questions? Further questions? Comments? Hearing none, move to a vote. All in favor signify by saying aye.
Aye.
Nays? Congratulations.
Thank you and
That
Merry
motion
Christmas.
carries. Merry Christmas to you. The good secretary has asked for a brief break. So my sense is that that gives us maybe a chance, Beth, to kind of reset where our funding levels are and kind of look through that.
I can actually give you numbers right now on number or where we're at. If you want to wait for those numbers until
What's the
after
pleasure of the
break.
board? You want to hear those numbers now or wait?
I've got them. Sure.
Okay. We go ahead and run them. That's fine.
Okay. Based on what has been approved, we have remaining 23,727,685 remaining in the general fund. We have $2,297,083 in the behavioral pot. We have $5,552,918 in the rural health. And in telehealth, we have a remaining $1,321,800 for a total of $30,602,403.
Thank you very much. All right. Well, let's, I see the time now as 10:13 or 11:13, sorry. So how about we resume at 11:30, no later? Okay? Thanks. And you might consider getting some food.
Oh, the telehealth. That's only three.
be respectful of people's times. It's been brought to my attention that Mr. Crum is here and has to catch a flight before 4. Let me put that out to others. Are there other critical timelines that are here? So, yes, ma'am, could you? Oh, tomorrow. Yeah, okay, thank you. Thank you. Okay. Well, thanks. That's just for the board's, and understand, we are really trying to make sure people have a chance to say what they can say. If they can say it efficiently, that's awesome. But we are going to try to sort of muscle through. So members of the board, you know what the balances are. And we have kind of taken a sort of a piecemeal approach so far, but how would you like to proceed? Mr. Secretary, Madam Auditor, Mr. Treasurer, Superintendent, I know you all have spent some time looking at all these, so I'll recognize whoever comes first.
Sure, Mr. Chairman.
Mr. Superintendent.
I'm wondering if we could, do I have to make a motion to bring up the next one?
Yep.
Okay, so I make a motion to consider application 1232 Ivinson Memorial Hospital.
Okay, Mr. Superintendent, thank you. That motion is to fund the Ivinson Memorial Hospital. Is there support for the superintendent's motion?
Mr. Chairman, I think we got to put the number to it if.
Yes.
Right, and it's, which number is that?
It's.
3 million?
1232, but would it be the dollar, 3125?
1232, this would be Ivinson Memorial Hospital Emergency Department expansion and renovation for $5,125,000. Thank you.
Right, and Mr. Chairman, the motion would be to take 2 million off of that and make it for 3,125,000.
Okay, so the motion is.
Second.
And that motion has been made and seconded. Just so people know, it's, the motion is now to fund it at $3,125,000. Any clarification, questions from the board?
Yeah, Mr. Chairman.
Mr. Treasurer.
I just looking at, they're already at a 58% match. If I'm reading this match thing right, I might not be, but I know we got to get some somewhere if we're going to fund a few people, but nothing further, Mr. Chairman.
Okay, thank you, Mr. Treasurer. Is there anyone here to, yep, please, come on up. Thank you.
Hello, my name is Doug Foss. I'm the CEO of Ivinson Memorial Hospital. I also have Gary Crum with me today, and so I'll say a few words and then bring Gary up. Our application really focused in on COVID. Thank you to the help of staff. They helped us remodel it a little bit to get it a little more fine-tuned. But just looking at our December stats for COVID, out of our ER visits, we're averaging about 37 patients a day. And so far in December, 41% of those patients are coming in with COVID or COVID-like symptoms. So that's the basis for why we're here today. Our ER, we were scheduled to do a remodel of it here in this time period, but with COVID has drastically changed our plan. We thought we would do a pretty light remodel and basically just touch it up as is, but it's clear that with this new world that we are not in a position to move forward with the current structure. So we have really revamped everything we'd thought. We are going to expand it from 8 to 13 rooms. 3 of those rooms are additional rooms that have isolation. And then one of those is a behavioral health room. Would also point out that we're only one of 4 hospitals in the state that actually provide inpatient behavioral services. So this will help us focus in on that as well. And then a big piece of this project is the HVAC, of course, to help us do negative pressure in those isolation rooms, which is something that we're only able to do in a couple of rooms at the current state. And then I guess the last couple of things I'll point out, we do have really good community support for our project, not only funds from Ivinson, but we have a foundation that is also going to go out and raise money for this project. So it'll be a very strongly supported community effort. And then I'd also point out that we've not come to this board for any projects at all for in the past for some of the COVID money. But with that, I'll turn it over to Gary Crum and have him comment a few.
Thank you, Mr. Foss. Mr. Crum.
My name's Gary Crum, and I'm from Laramie. I'm a member of the Ivinson Hospital Board of Directors. First of all, let me say thank you for taking time with us today. We appreciate it. Our hospital, you know, as Doug said, we started this project. We were going to remodel our hospital, our emergency room, for about roughly $2 million. Go in and clean it up, make it better. It's a 30-year-old emergency room. But COVID hit us, and it became overwhelming like it did for everybody else in the state. And looking at our project, knowing that our emergency room needed updated, but with the COVID situation, that project now is $12 to $14 million, based on exactly what construction costs are today. This emergency room, as Doug said, will bring in new ventilation, so much so that we've had to change our ambulance bays. We've had to relocate the ambulance bays to use those now as part of the emergency room. Also, we're putting in, as it was said earlier, it's caused a lot of mental stress in our communities. We're building into this emergency room to help with the COVID mental stress, some mental rooms so people can come in and work on psychiatric needs right within the emergency room so they can be handled, the acute cases right there. So it's very, very COVID related. It was about a $2 million project. COVID's caused this thing to go to $12 to $14 million. So we very much appreciate your consideration. The other thing I'd like to say is this, well, it's a project in Laramie. This is really, in many ways, a statewide project. As we all know, a lot of people come to Laramie for different things, for ball games, for graduation, and have students there. Our patient mix is a lot of students come to our emergency room every day. When we have a football game, our emergency room doubles. And it's everything that you can think of, from wrecks, you know, people falling down and different things, but it's also COVID. And as Doug said, 40% of that right now, 41% actually, is COVID related in the month of December. So it is a COVID project. It's a Laramie project, but it's also in a lot of ways a state of Wyoming project. So with that, I very much say thank you for your consideration.
Thanks, Gary. None of that is because your son is such an awesome football player, is it?
None of it at all, although he did visit it this year.
My daughter also has been to that ER, but not this year. Any questions?
Mr. Chairman,
Madam Auditor.
what I really want to know is, can you move forward with a $3 million funding amount?
Yes, ma'am. We're very, very fortunate. As Doug said earlier, we have a great hospital foundation that's going to step up and help, as well as we've worked really hard on our fiscal management, and we have some resources internally to fund that different $2 million. So thank you for the question.
Thank you, Mr. Crum. Further questions? Is there anyone else that wants to address the board? I don't see any. So with that, members of the board, I'm going to ask for the vote. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Congratulations. Thank you. All right. Moving on, members of the board.
Mr. Chairman,
Madam Auditor.
I would move that we do not fund item number 1230, Child Development Center of Natrona County ARPA Energy Efficiency Project.
Okay. That motion's been made, seconded by the auditor, seconded by the secretary. 1230, Child Development Center of Natrona County ARPA Energy Efficient Project, $45,364. Is anyone here that wants to address that project? Anyone here? Anyone online? Anyone online? Anyone online? I see none. Any questions or discussion? Not? The motion to do not fund, item number 1230, all in favor signify by saying aye.
Aye.
Nays? That motion carries. Okay.
Mr. Chairman.
Mr. Secretary.
Mr. Chairman, I would move that number 1224, Town of Powell Hospital District completion of second floor, that we do not fund.
1224, Powell Hospital District, completion of second floor of family practice clinic, priority 2 of 4 for $2,245,795. Is that supported?
Second.
Okay, that motion has been made by the secretary, seconded by the auditor. Is there anyone here to discuss that project? Anyone here? Anyone online? I do see a Peyton Gambill. I will recognize you if you want to address the board, please.
Thank you, Mr. Chairman and members of the board. I, Peyton, am here with my team here at Powell. I'm with Terry Odom, our CEO, and Scott Schopa, our Director of Facilities Management. We would like to just reiterate how important this project is, not only to the viability of our practice, but to be able to protect patients and staff from the ongoing COVID pandemic and the social distancing requirements for healthcare facilities, as well as infection control risks. The buildings that these services are currently provided in do not have the proper HVAC or the social distancing capacity. And that was realized as we worked through the COVID pandemic. Do you have anything to add?
Yes, my name is Scott Shope. I'm the Director of Facilities Management. So just to give you a context of the buildings we're trying to get out of in favor of building out the shell space of our current medical office building, is that these buildings are 70s designed, 1980s constructed. They have problems with water intrusion and some infestation issues. And essentially they're beyond useful life. We consider them too small for social distancing purposes. They're dispersed from the rest of the campus, and they're not conducive to medical collaboration. Our new project that we're proposing will allow for social distancing, will improve infection control practices, and also support the retainage and recruitment of physicians to the Bighorn Basin region. We believe that this project is designed very carefully for the needs of patients in our regions, and we're very strongly in favor of asking for your help on this.
Thank you very much. Questions? Questions?
Mr. Chairman, just a quick question. I'm trying to, again, understand, is this a proactive response, preparing for the future, or responding to the COVID needs currently?
Mr. Chairman?
Yes, Ms. Rambo, go ahead.
This is Terry Odom. This is both a continued response as well as a proactive response. We currently see patients in the outlying buildings for our specialty services, and we would like to relocate those to the second floor of the medical office building. We see patients in general surgery, orthopedics, OBGYN in these small buildings that we're not able to separate the patients, and we have issues with infection prevention currently and in the future.
Okay, thank you. Further questions?
Yeah, Mr. Chairman,
Mr. Treasurer.
would this be a time to consider an amendment on this?
And I think that would be fine if you want to.
Yep, Mr. Chairman, I would amend it from the entire 2.245795 reduction to provide for $612,690 to be used for HVAC.
Okay.
And as other needs determined by the entity in consultation with the Office of the State Lands.
Okay, thank you, Mr. Treasurer. Is there support for the Treasurer's amendment? Is there support for the Treasurer's amendment?
Could you repeat it, Mr. Chairman or Mr. Treasurer, from what to what?
Well, it's to leave 612,690 of the proposed appropriation intact and delete the rest.
So that's the motion being.
That is the motion.
And that's
primarily
for the HVAC portion that should be relatively low risk and not be subject to much federal scrutiny.
Okay, I would second that, Mr. Chairman.
Okay, the amendment to reduce the funding from the full amount of $2,245,795,000 to $612,690 to fund HVAC. That amendment is before us. I'm going to ask Ms. Gambill and I'm sorry, I can't remember who else is on your phone up there, but either of you, if you have comments on that. Ask one more time. Any comment?
Mr. Chairman, this is Terry Odom. I'm the CEO.
Thank you.
We appreciate your consideration of funding, even at a reduced rate. The issue with the outbuildings is not an HVAC issue. It is a social distancing issue and an infection prevention issue. Powell sits, our water table is high. We have flooding in the 3 buildings every summer, and we have sump pumps. It continues to be an infection prevention issue. And we are unable to social distance for the patients in the waiting areas in these 3 buildings. If we relocate to the 2nd floor of the medical office building, which was built in 2010, we will be able to not have the problem of flooding, as well as have enough space for our patients to social distance, as well as the staff.
Okay, thank you. Further questions? Further questions?
Clarification, Mr. Chairman.
Mr. Treasurer.
I thought that you were going to need that $600 and some thousand for HVAC in the building you were relocated in. So that's, I guess, what this is for, the amendment. So am I mistaken on that?
Over to you.
Are you asking us, Mr. Chairman?
Yes, yep, to you.
So, Mr. Chairman, this is Scott Shopa again. We're wondering if the HVAC concern that you're bringing up is related to a separate project that we had applied for. The project we're wondering if you're getting this confused with is the 1241 OR renovation. It might not be, but I'm just trying to make sure we're not cross-talking two projects.
I'm just reading off of some
Thank you.
Information that we had on this particular project, but I guess I'd look to staff to see whether or not we were cross-pollinating these things.
So again, the current project that we're talking about is relocating out of old buildings that have infection control problems and social distancing issues into a new space that is currently enclosed but shelled, so that we can have a cleaner, safer care environment for our specialty care clinics.
And I do think we understand that. Ms. Blackwell or Mr. Miller, do you want to add a little bit of definition to?
Mr. Chairman, Mr. Treasurer, per the conceptual cost estimate submitted with this project, it does include a line item. It's line item or total division 23 is HVAC. It identifies a total project amount of $612,690 within their application. I believe it's as part of their answer to question number 2 on their narrative. It states the current air handler units that the clinic buildings are equipped with do not meet requirements. With the completion of the second floor clinic care areas, the HVAC air supply will be much improved from the current mechanisms of air supply to eliminate exposure to airborne illnesses.
Thank you, Ms. Blackwell. So that is the nature of the amendment. If there's any clarification you want to add to that.
At this time, we're not going
Go ahead.
to add anything to that.
Pardon me, you want to repeat yourself? I'm not sure we heard that.
We have nothing more to add to that at this moment.
Okay. All right. Further questions, comments, members of the board? We have an amendment before us. And so the matter we're going to consider at this point is the amendment to reduce funding to the $612,690 that has been discussed.
Can we have some discussion on that?
Yes, that's what I'm going to, yeah.
Mr. Chairman, I will be a no vote on the amendment, and my concern is for the guidelines. I think what I feared sort of was the case, and I understand the challenges you have described. However, my concern is the flooding of the facilities, and some of those issues are no doubt dire, but don't have anything to do with COVID. And the guidelines for these funds make capital expenditures are fairly risky expenditures under these funds, but there's specific guidance that says capital expenditures for social distancing only are really not appropriate. So that's why I will be a no vote on the amendment.
Thank you, Madam Auditor. Mr. Secretary.
Thank you, Mr. Chairman. I also will be a no vote, but in reading in the application, the only reference here that they've got on Airhand is saying that the current ones the clinics have don't meet what they need. And if they go to the second floor, that the HVAC air supply will just be improved because I guess what's already in that building, that it's better than what is in the ones they want to move out of. So I don't think that the amendment really is appropriate. Thank you.
Okay, and Mr. Treasurer.
Well, Mr. Chairman, I think from what I've got here, there's confusion with the applicant as to whether or not they need to modify the HVAC in the second building that they would be moving into. That was my assumption. I'm going to withdraw the amendment, Mr. Chairman. I'll leave it at that.
Okay, it's been withdrawn. Mr. Secretary, do you accept that as well?
Yes, sir.
Okay. The amendment is off. We are now back on the main motion. And question's been called. All in favor signify by saying aye.
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 Nays? Okay, that motion to not fund item 1224 has passed. Thank you.
Mr. Chairman,
Madam Auditor.
I would move that we do not fund item 1226. So a no fund on the $5.731705 million ask
Okay.
Teton County Hospital District Housing for staffing stabilization.
Okay, you've heard the auditor's motion. It's been seconded by the Secretary of State. Discussion. Do we have people here to discuss? I see Ms. Olson online and Mr. Robertson. Ms. Olson.
Thank you, Mr. Chairman and committee. You did already hear from us before, and Mr. Robertson obviously can you hear me, Mr. Chairman? Sorry.
We can, yes.
Okay, thank you. Mr. Robertson did speak, and I both of us spoke to the housing issue this morning, and so I won't take up your time readdressing that. However, you know, the ongoing COVID impact on this community cannot be explained enough with, I mean, just the lack of housing that we are facing that is directly impacting and was impactful during COVID, because we cannot house enough employees to treat the demand that we have. And my understanding that this particular request is an allowable use under Treasury guidance, is something that I just want to make sure the entire board today is familiar with that. I know housing is coming at you from across the state, workforce housing as an issue, but this really has been a COVID-driven hockey stick of an impact here in Teton County, and, you know, pandemic related. And as I said, is allowable under Treasury guidance. So we really strongly request that you consider keeping us and having a motion to support this application. Thank you.
Thank you, Ms. Olson, and I think the case you make is a very correct one, so thank you very much. Mr. Robertson.
Yeah, Mr. Chairman, members of the committee, you know, I've already discussed you know, what I have indicated, you know, I feel is the most significant existential threat to healthcare in Teton County, and that is the issues surrounding housing. But let me just put into perspective a little bit. We have seen, as I mentioned previously, we have seen the cost of home ownership during the pandemic go way beyond the potential for anyone at St. John's to be able to afford a home. That includes physicians. That in fact includes our, we have a new CEO beginning next year, and he is not able to afford housing within Teton County, Wyoming. The current published market rent in Teton County and in Jackson for a studio apartment. So a studio apartment is less than 500 square feet, is $2,639 a month. A 2-bedroom apartment of approximately 800 square feet is $4,172 a month on average. In order for those to be affordable by HUD's definition of affordability, meaning no more than 30% of your income is going to housing, an individual, in order to be able to afford a studio apartment, has to earn just under $106,000 a year, and a 2-bedroom apartment, $167,000 a year. The free market system for housing in Teton County is absolutely not working for working class people. It's not working for healthcare. There is nothing about the healthcare system and how healthcare is reimbursed for services that provides reimbursement in high-cost housing areas. The only way that we can be in a position to recruit individuals, and in healthcare, huge numbers of who we have to recruit are people with special licensure, special degrees, special certification. It's not a matter of recruiting from, another employer in town. It is bringing people in from out of state, and we have to have a place that they can live, or they can't even consider it because we cannot pay them enough to be able to buy a home. And in most cases, we cannot be able to pay them enough to be able to afford rent. And so what we are doing is working diligently to develop hospital-owned housing where we set rates based on an individual's income, based on the HUD definition of affordability, so that we can assure people that if they choose to come here, that they will be able to afford to live and that they will have housing that will not be pulled out from under them, which is happening every day to our staff because they live in an apartment or in a home with the owner choosing to sell it because of the high market valuations that have come as a result of the doubling of housing prices during the pandemic. So this is absolutely an existential threat for us in Teton County. And I would strongly encourage you to not remove this from the agenda and from the list of consideration. I'd be happy to address any questions.
Thank you, Mr. Robertson. And I would note for the board that St. John's did a phenomenal job during the pandemic. One of the problems that they had was that they had staff that could sell homes they bought at a fairly minimal rate for vastly inflated rates and then go make lots more money in places like Texas. So I think the communities had a hit. And then I, just want to make sure that people remember this is a recapture district now. Teton is helping to fund schools in places like Niobrara and other counties. I just wanted to make sure the board was aware of that. I'm going to have to step away for a little bit and turn the podium over to the good secretary for the remainder of this, and I'll be back in a moment. Thank you.
Thank you, Mr. Chairman. Was there any other comments that need to be made on this?
Mr. Chairman.
Ms. Auditor.
I just want to explain my making of the motion. Again, we are in a situation where we have way more good projects than we do have funds to go around. And I would just point out, again, not that any of this wasn't deserved or over-deserved. Teton County Hospital District was nearly the highest recipient of CARES Act money from this board. So that's just something that's playing into my decision, going back to trying to spread a very limited amount of dollars, which are never going to be enough, kind of across the state. That's all, Mr. Chairman.
Thank you. Mr. Treasurer.
And I want the folks in Teton County to know that we're all well aware of the housing problem. And we understand some of your constraints. We face a lot of those constraints as a state too, as far as rules, regulations, the inability to source development land. There's a number of things that are driving up the cost of housing in Teton County. I sit on the WCDA, and I know that I think we're finally getting some federal help as far as some of the programs that we can utilize in Teton County, but it's a big problem, and I hope that the legislature works on it. And I know we're going to try to be doing whatever we can. Unfortunately, there's not enough food in the buffet today, and we have to look at it, I think, in that way. But we do think that there are going to be some more funds coming toward different issues, that this issue, one of them, and hopefully we can add our voice and support for housing in areas such as Teton County in the upcoming session.
Thank you, Mr. Treasurer. Any other comments? Anyone in the audience? Any more comments from the board? Okay, I think we'll go ahead and go to the vote. The motion is that we do not fund on Teton County housing. All in favor of the motion, say aye.
Aye.
Any opposed? Okay, that motion passes. We do not fund that one. Any other motion?
Mr. Chairman,
Ms. Auditor.
I would move that we do fund ARPA 1137, Wyoming Medical Center, EICU, out of the telehealth bucket in the amount of 140,165.
Second.
Okay, that motion's been made by the auditor and seconded by the treasurer. Are there any comments on this? Okay, I'm gonna have to look to you guys. I don't have it on here if there's somebody online. Is there anybody online there?
Mr. Chairman, no hands raised at the moment.
Okay, anybody in the room? Any comments from the board?
Question.
Okay, question being called. The motion is to fund number 1137, Wyoming Medical Center.
1132.
Or 132.
1132.
No,
We had-
1137.
No, 1137, yes.
Oh, I'm sorry. I
The
circled
Wyoming
it.
Medical Center, EICU, and that would come out of the telehealth bucket. All those in favor?
Aye.
Aye.
Any opposed? That motion passes. Now that the governor's back in, I'll turn it back over to him.
Okay.
We finished.
Yeah, no, I realize that. I do see Mr. Porter is on, and I don't know if Mr. Porter did you listen to Mr. Porter's comments?
No, they said at that time when I was asking, nobody was
Okay,
up for it.
okay. Mr. Porter, if you'd like to address the board.
Good morning, Mr. Chairman. This is Lance Porter. I'm sorry I was a little late. Just for clarification, I'm reviewing 1132.
You're breaking up pretty badly. So if you can sort of go at it slow, that'd be great.
Okay. Mr. Chairman, can you hear me?
We can hear you, and I think when you put 2 or 3 words together in quick succession, you start breaking up.
Wow.
We got that one.
I am sorry for the confusion.
Go
Are
ahead.
we doing 1132 or 1137?
That was 1137.
We just did 1137. And that passed.
Okay. Would you like me to address 32 then?
Is 1132 on in front of us?
No. Not
It is not in front of us at this point. So when that comes up, we will get back to you.
Okay. Do you have
Thank-
any other questions for me then on 1137?
1137 has been dealt with.
Okay.
It is funded.
Thank
Thank
Call
you.
back on and fix my audio.
Thank you. Okay. Next.
Mr. Chairman,
Madam Auditor.
I would move that we do not fund ARPA 1090 Torrington Community Hospital Inpatient Unit in the amount of $7,187,656.
So we are, the motion has been made to not fund 1090 Torrington Community Hospital Inpatient Unit for $7,187,656.
Second.
Okay, that's been moved and seconded. Moved by the auditor, seconded by the superintendent. Is there any discussion from the board? If not, I see a Jennifer McMillan. And if so, Ms. McMillan, you have the floor.
Thank you. Can you hear me?
We can hear you, yes.
Fantastic. So I would ask for a reconsideration of this application for a couple primary reasons. The layout of our facility at this point in time does not provide adequate social distancing or distancing of patients with respiratory illnesses, of which COVID is primary and forefront in our minds at this point in time, although it has been a very heavy RSV season. In 2021, we had 123 COVID admissions, and the most of our patient rooms are dual occupancy, and they have a shared bathroom, but they do not have any bathing facilities. So this poses a problem in a community where there is one hospital of a critical access size when you are trying to take care of patients who both have a respiratory illness that is communicable, or patients, and as well patients who are ill with something else, or are post-surgical, or potentially a swing bed, or a patient who is waiting to be moved to a nursing home. This creates a throughput problem when we do not have the ability to accept any more patients because of infectious disease and co-locating and things of that nature. This hospital location was constructed in 1967, and over half of the inpatient rooms are still semi-private. This also requires increased testing for COVID and other communicable diseases prior to placing patients in a room together. Walking patients who have a communicable disease through the hallway for your bathing is not only not in line with how we would like to deliver care, but also increases the risk of contamination, as well as the extra risk of having a shared bathing facility. Our options that we tried to approach when providing alternatives were either more expensive or as expensive and created more disruption to services than the original proposal that we have before you. Our community so far in 22 has seen 64 COVID admissions, And that is only looking at COVID and not at any other communicable disease. So hopefully that is a little bit additional background that might provide some additional insight as to why this application is very necessary to this community. For our hospital to be able to provide safe care to patients who are struggling with a respiratory illness, and to provide them dignity as well as the necessary facilities, and to be able to provide the volume that our facility needs. One other thing I will add in there is at the height of COVID, it was very, very difficult to transfer patients to other facilities when we were at capacity, because other facilities were experiencing the same thing. So increasing our ability to keep patients who are contagious will be a benefit to the community.
Mr. Treasurer.
Okay, I want to, I guess, drill down in this a little bit and have you distinguish between the $7 million in which you consider as social distancing and the $7 million in which you consider medical distancing as how I guess I would or medical isolation. I know in the past we've had, I think, a hospital that was up in Commerce County that this might be, I might be misspeaking, but we had to put in other entryways because everybody that came in the front door or came into the emergency area, basically they were commingled with everybody else, and you couldn't isolate communicable diseases from or COVID diseases or any of them from the other general hospital population. So I want to be really clear for you to determine that medical distancing and leave social distancing out of your vocabulary, because that's something that we really don't look at as far as a reason to use any ARPA dollars. So could you be a little more, I guess, distinct on medical distancing?
Yes, absolutely, and thank you. That is a really good point, and I appreciate you bringing that up. Really, when it comes down to it, we have one primary corridor that all of our patients' rooms come up against, and that is the corridor that the public goes down to see their family members, and it is also the corridor that patients use when they are going to and from the shared bathing facilities. None of the rooms have anything other than just a toilet and a sink at this point in time. And the majority of the rooms are dual occupancy. So when we have patients who have a communicable disease, such as COVID, we do have to try and co-locate them together, which isn't optimal. And our state standards at this point in time for new construction is for single occupancy rooms for a lot of these same reasons. And co-sharing a toilet and a sink is definitely not what our sanitation standards are for communicable diseases. So when we start reaching capacity and we look at how can we take additional patients, it's a delicate balancing act with the type of rooms that we have and the need of the patients who are coming in from directly from the doctor's office or through the emergency room who need placement. Do we have the ability to put a patient who is not contagious in a room where they will not be in the same room as someone who is contagious, knowing that they have shared toilet and sink facilities? And so that is part of the act.
Mr. Treasurer.
Try to guide this along to I guess a little quicker end on this. As far as your fix on this, is it to add bathing facilities in the rooms, make them single rooms and add more rooms and other entryways and get rid of the common entryway and try to do some isolation? Is that contemplated in your engineering plan and your architectural plan at this time?
The primary focus of the plan would be to build a new unit adjacent to the facility, but not connected until it is completed, with single occupancy rooms with toilet, shower, and sink, so that there is no shared bathing, which would eliminate the need for patients who are contagious to be in the public hallway at any time during their stay. It would also allow for more throughput and less need for testing for patients to be needing to be co-located in a dual occupancy room. It would allow us to have more capacity, I guess is what I'm saying, because we would not be running into capacity issues where we couldn't accept anyone else and need to transfer them out, which is something that we experienced during the height of our COVID pandemic experience. So the primary thrust would be individual rooms with the individual sanitation facilities, and it would allow for continuation of care during the construction process, because it would be adjacent to the facility and it would be connected at the very end of the construction project. That would allow the facility to continue to operate and serve the community with capacity and throughput, rather than limiting our ability to accept patients throughout the construction period.
And the total follow-up, Mr. Chairman, and the total
Yes.
cost of this project is how much?
I'm sorry, were you asking me?
Yeah, yes, I was.
Yes, the total cost is 14 million. And so we were asking for half of that with banner matching. So 14,375,312. This was the most affordable option, with building adjacent and not tying into existing building structures and tying in at the very last minute. Least business disruption and the most cost effective.
Thank you. Thank you. Further questions and comments?
Just one comment, Mr.
Yep.
Chairman. I guess
Please, Mr.
when we look at this project compared to a lot of the other projects that we've had, it seems like we're trying to put about $1 out of $7 into the project, and even though some of these are 50-50 matches, the extra money doesn't show up on the outside of that. This seems like that if we were looking at that, we would probably go down to 2 million, and that would be kind of in line with a lot of the other things that we've done with this particular pot of money. It sounds like it's the same thing that with what they're trying to do is isolate contagious people and COVID people from each other. It's the same thing that we've done with CARES Act money. So I would ask that we amend this down to $2 million and hope for a second and a favorable consideration by the board.
So just to be clear, Mr. Treasurer, you are seeking to amend the auditor's motion by recommending funding by $2 million.
Yes, they're requesting 7, and as I just the last one with went into the detail in Sblc County, that was about the ratio was about a 1 to 7 for the state or these ARPA funds going into it to funds from all other resources. So I would recommend that we fund it kind of consistent with that funding.
Okay, thank you, Mr. Treasurer. Is there support for the treasurer's motion? Is there support for the treasurer's motion? Is there support for the treasurer's motion? Motion fails for lack of a second. Thank you. Back on the main motion. Further questions, comments?
Yes, Mr. Chairman, I just have one quick question. If I missed it, forgive me, and I didn't catch the name of the representative for Torrington Community Hospital, but ma'am, do you did you provide or did you share with us any quantitative statistics on your current COVID patient load?
Good afternoon, and you're absolutely right. I did not introduce myself. I think I was a little nervous. My name is Jennifer McMillan. I'm the Chief Financial Officer for Torrington. I believe in looking at my application, I did not provide quantitative statistics on COVID specifically, but more focused on the community we serve and the experience that we had through the COVID pandemic. But I do have statistics before me this morning that I'm happy to share if that would be beneficial.
Yes, please.
So in 2021, we had 123 inpatient admissions for COVID-19, which is fairly substantial for our community for one disease process alone. In 2022, through the end of November, we had 64, which granted is half of that, but as different variants come to light, and as we have seen a higher need for isolation, utilization, and segmenting contagious disease patients away from the general population of ill patients, it does create a logistical issue to have the physical layout that we have at this time. When we look at outpatient volumes, we're very similar to 21. And I know we're not talking about an outpatient area, but it really speaks to the COVID volume load that we have in our community. So last year we had 545 outpatient cases for COVID, and this year through November we had 483. So we're on track to come very similar to 2021. And in our ED, we're seeing very similar levels as well, 189 last year and 143 through November of this year. So our community is still seeing a fairly decent amount of COVID, and other respiratory illnesses as well are having a rampant year this year. I don't have that data ahead of me, but RSV has been very impactful this year already. And so it is imperative from our perspective to be able to provide, as a sole community hospital, the appropriate level of care to our patients. And with the rise in communicable respiratory illnesses, our proposal meets the needs of our community at this time.
Okay, thank you.
Thank you. Further questions, comments, clarifications? Further? I don't hear any. Members of the board, I think we'll move to a vote. All in favor of not funding item 1090, Torrington Community Hospital Inpatient Unit for $7,187,656, signify by saying aye.
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 Nays? There is a nay, and the motion does carry. Mr. Secretary.
Mr. Chairman, just looking at combining a couple of these are all pretty much the same type of deal. I would like to move that we fund 1099. That's the ambulance building in Hannah for 260. Also 1236, which is the same thing in Johnson County in Buffalo for 450. And the Powell, again, same thing for 402,889.
And
That was 1239.
Okay, so
Second,
that motion has been made by the secretary, seconded by the auditor. Item number 1099, South Central Wyoming Emergency Medical Services Joint Powers Board, the station and Hannah. 1236 Johnson County Rural Healthcare District Emergency Services Building for $450. And 1239, which is the Powell Hospital District Ambulance Garage, $402,889. Just to check with Ms. Blackwell, Ms. Zoul, those numbers are all correct? Great, thank you. Please speak to your motion, sir.
Thank you, Mr. Chairman. All three of these deal with communities where they do not have a place to put their ambulances to sufficiently clean and disinfect them afterwards. And as we all know, we carry some pretty bad situations in these ambulances sometimes. And and of course, in accordance with Wyoming's beautiful weather outside, doing it outdoors is not an option in the middle of the winter, and those ambulances need to be kept ready to go at a moment's notice. And so I believe that all these projects are well worthwhile, and so I would recommend that we fund these.
Thank you. Any further considerations? If anyone wants to address this, I'll point out, as another governor did, I think the train is on the tracks and moving in the right direction for you. But if you want to address the board, take it off the rails, you certainly can. But if there is no further discussion, I would, and I don't see any. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Thank you.
Mr. Chairman,
Mr. Superintendent.
I would make a motion that we fund ARPA number 1024, the Memorial Hospital, Sheridan County, the SMH Emergency Department Triage renovation, to the tune of $480,000.
Yeah, motion's been made by the superintendent. Is there support? It's been seconded by the treasurer. Is that correct, Mr. Treasurer? Thank you. So it's 1024 Memorial Hospital, Sheridan County, SMH Emergency Department Triage renovation for $480,000. Are there any questions? I do see Mr. McCafferty. Mr. McCafferty, floor is yours.
Thank you, Mr. Chairman. I just want to make myself available and certainly don't want to take the train off the tracks. I just wanted to add, as I talked about at the last meeting with this project, it's very important for our community. We see a lot of people coming through our emergency department in a lot of different categories, whether it be respiratory illness and disease, medical and physical trauma, as well as psychiatric or behavioral health issues. And this project really sets out to provide isolation for those patients in a triage manner that we don't currently have. And I would take any questions that you have, and thanks again for your consideration.
Thank you, Mr. McCafferty. Any questions? Any questions? Any questions? Hearing none. All in favor signify by saying aye.
Aye.
Nays? That motion carries.
Mr. Chairman,
Madam Auditor.
I'd move funding of $300,000 on 1072 Goshen Healthcare Community Alzheimer's Wing Air Quality Improvement Project.
Second. Okay, that motion's been made by the auditor, seconded by the treasurer. You've heard it. 1072 Goshen Healthcare Community Alzheimer's Wing for $300,000. Is there any question? Is there anyone to address the board? Mr. Balham, are you on? Horn?
Can you hear me okay?
We can.
All right. This is Paul Balhorn with Veterans Healthcare. I'm the CIO for the company, and I have the lovely pleasure to also cover facilities and physical plant. So here, just want to thank you for your recommendation. The community itself has, we've got an Alzheimer's wing as well as the nursing, skilled nursing side. This will go a long ways to help us with our air quality improvement for that side of the building, these patients are especially at risk with regard to COVID. So anything we can do to improve it for their outcomes is great. So thank you very much.
Thank you very much. Any further questions? Further questions? Hearing none, all in favor signify by saying aye.
Aye.
Nays? That motion carries.
Mr. Chairman,
Mr. Secretary.
I'd like to move 1052, Platte Valley Healthcare Project, in the amount of $3,500,000 going to the rural bucket.
Okay, thank you, Mr. Secretary. Is there support for the Secretary's motion?
Second.
Motion been made and seconded by the auditor. This is the Platte Valley Healthcare Project, DBA North Platte Valley Medical Center, construction, $3,500,000. Any questions? Is there anyone here to, looks to me like there's a whole section here too. Please approach and just identify yourself. And
sure, and I'll be very, Mr. Chairman and Board.
Red, you have to.
Red, okay, can you hear me now? Mr. Chairman and Board, thank you for your consideration. My name is Will Faust. I'm the chairman of the Platte Valley Healthcare Project Board. We were formed about 4 years ago to address the need in our communities, which are Saratoga, Encampment, Riverside, and then the unincorporated area of Ryan Park. Our healthcare system was failing. With a lot of community support and partnership, we have been actively constructing a hospital in Saratoga. So we have a greenfield project. This will replace our aging nursing home that is literally falling apart as we speak. Provide 24-hour care, hospital services, and many other opportunities for our communities. We have seen a vast amount of community support, as witnessed by both participation in the project and dollars raised, and really appreciate you all considering this project.
Thank you, Ms. Bowles. Please.
I'm Jeffrey Mincy. I'm the CEO of the North Platte Valley Medical Center, and I just want to make myself available to answer any questions that you have and support, and appreciate your support for the project.
Thank you very much. Any questions? Any questions? Well, you got off easy. Thank you for, but you got to drive home too, so good luck with that. Any further questions? Any further questions? Okay, all in favor signify by saying aye.
Aye.
Congratulations. It sounds like your motion's carried. I'll better ask if there are any nays. There are none. Thank you. Congratulations.
Mr. Chairman,
Madam Auditor.
I would move due fund 358903 on ARPA 1085 St. Joe's for their new generator.
All right, thank you, Madam Auditor. Is there support for the auditor's motion?
Second.
It's been seconded by the Secretary of State. Is there any discussion? Any discussion? Is there anyone from St. Joseph's or Goshen County that would like to address the board on this? I don't see anyone. Is there anyone here? Oh, there you are. I'm sorry, I'm looking at my computer.
Okay. Good afternoon. Rhonda Meyer, Executive Director, St. Joseph's Children's Home. I'm just here to answer any questions that you may have, and I appreciate you considering this project. The generator replacement, in addition, does support our existing residential units, specifically our Newell's Children's Center, which is our secure unit. So it houses those children that need a secure setting, which is currently completely full in occupancy. So the generator would support that building, its security system, as well as its HVAC system. We're also asking to add a generator to one of our other buildings, our administrative building, to support the IT infrastructure. We have seen quite an increase in the use of that infrastructure with the utilization of telehealth. So we have benefited from CARES Act funding for telehealth equipment so that we could expand our infrastructure to provide family therapy sessions as well as psychiatric services via telehealth. And so this generator project does support our existing infrastructure and existing services. And I'm happy to stand for any questions that you may have.
Well, thank you very, very much. Are there any questions? Well, I have one. That nice snowplow that sits out in front there, does anybody ever get to use that? The big train one?
Yeah, oh, right. Yeah, right. I wish. Right.
Any questions? Hearing none, all in favor signify by saying aye.
Aye.
Nays? Congratulations.
Mr. Chairman,
Madam Auditor.
I would move that we do not fund item 1248. That's the third of three priorities for St. Joe's in the amount of $135,000.
Okay, so this is item 1248, St. Joseph's Children's Home Security Update and Addition, priority 2 of 3. And that's for $135,000. You thought you were going to get away. Let me ask first, though, is there support for the auditor's motion?
Second.
It's been moved and seconded. Thank you. Now.
Chairman. Board members, let me just speak to this particular project. Like I mentioned, the Newell Children's Center is our secure lockdown facility. It is currently secure. We need to update that security system. And as I mentioned, it is full. It is at capacity. And we have seen quite an increase in the need for a secure setting for juveniles. And we at this point are not able to accept any other youth into our facility that need a secure setting. This project would also allow us to secure another one of our buildings called the Bosco Children's Center. It is one of our newer buildings. It was built in 2004, but it is currently not equipped to be a secure building. And so we want to secure that facility to expand our capacity to be able to serve youth that are in need of a secure setting. And I'll stand for any questions.
Thank you. Are there any questions? Any questions? Any questions? Hearing none, move to vote. Thank you very much for being here, by the way. And actually, I did have one question. You and how many other providers are there for the services that you have in the state?
So St. Joseph's Children's Home is a psychiatric residential treatment facility, PRTF. There are only 2 in-state providers in the state of Wyoming, St. Joseph's Children's Home and Wyoming Behavioral Institute in Casper.
That's what I was thinking.
To follow up on that, Mr. Chairman?
Yeah.
And how many folks that are currently being treated in Salt Lake or other places out of state?
Chairman, Treasurer, I would have to defer to Director Johansson to maybe answer that question. I could not answer that question. I can tell you that we are licensed for 62 beds. We're currently at capacity, at our carrying capacity right now, which is 40, and that's because we're having some staffing issues. That's looking up, and so we're hoping to increase our capacity here after the first of the year. But we certainly have quite an extensive wait list of children that need our services.
Yeah, Mr. Chairman, I bring that up because I recall when I was on Labor and Health and Judiciary and Appropriations, there was always a relationship between our internal capacity and what we are able to charge and keep in the state and the extremely, I guess, inflated charges that took place outside of the state. So it's just it's much more economical to treat these folks inside the state. No.
Mr. Chairman?
Mr. Superintendent.
Yeah, thank you, Mr. Treasurer, for that. I would add to that and urge the board to consider helping St. Joseph's with $135,000. because it's only $135,000, and the work these people do is some of the most difficult work, if not the most difficult in all of the helping professions. I was in this field for 14 and a half years, the residential treatment facility world, and they need all the help and support and encouragement we could possibly give them. The turnover is huge, the burnout is very high. So I would urge the board to consider funding this and helping them. Thank you.
Okay, thank you, Mr. Superintendent. Any further? The motion on the table is to not fund item 1248.
Mr. Chairman.
Madam Auditor.
Just a few thoughts on why I made the motion. I don't disagree with any of the statements, and I appreciate the work you do. It's hard to even process. The reason I made the motion the way I did is we granted St. Joe's over 1.4 million at our last meeting, which was their second priority. We've just granted their first priority of 358,000. So they're, I'm again just in spirit of trying to spread around, and I recognize that the $135 amount is low, but the tie to COVID is a little bit of a stretch. And just because it's a low dollar amount doesn't mean we should completely disregard the ARPA guidelines, and I do not believe this fits in the ARPA guidelines.
To make it worse.
And so, Mr. Chairman, just explaining the reason I made the motion.
I appreciate that. Thank you, Madam Auditor. Any further discussion? Okay, we'll go to vote. All in favor signify by saying aye.
Aye.
Nays?
Nay.
Huh? Don't you love this? I will also be a nay on this one. Thank you.
Thank you for your support.
Thank you.
Mr. Chairman,
Mr. Secretary.
I would like to move 1009 Memorial Hospital, Sweetwater County, their lab renovation for the amount of $4,363,238.
Okay, that's a motion to move for funding. Is there support?
I'll second, Mr. Chairman.
It's been moved by the Secretary, seconded by the Auditor, $4,363,238. Is that the correct number, Ms. Sewell?
I'm sorry, there were a lot of numbers. Could you please repeat that?
This is the very first one, 1009, Memorial Hospital of Sweetwater County Lab Renovation Priority 1 of 2, $4,363,238.
That is correct.
When everybody else is huddled over on the corner, you better watch out. We're coming after you. Just kidding. All right. So are there any questions? I do see Ms. Marshall, who is online. Ms. Marshall, if you'd like to address the board, happy to have you do that.
Good afternoon, Chairman and members of the board. We definitely don't want to derail your train anymore, so we're going to say thank you so much and answer any questions you may have.
Okay, thank you. Are there any questions?
Yeah, Mr. Chairman.
Mr. Treasurer.
I'm just wondering how they're getting their labs now. I recall in the first part of COVID, we were sending Highway Patrol and National Guard and everybody else around the state with samples to go to labs, and I wonder if this is did their analysis on the least cost way to get COVID samples tested, or I'm wondering, is this 100% COVID testing labs, or is this a general lab for the hospital in itself, or I'm wondering that proportionality that we talk about from time to time.
Sure, I'm happy to answer, Mr. Treasurer and Mr. Chairman. So we process our COVID tests in-house with our analyzers. We have ran over 50,000 COVID tests, In addition to the COVID tests that we process, we also execute roughly 5,700 patient visits per month, and we run over 47,700 tests per month. So we are a very, very busy lab.
I guess that's to my point that it's getting done now. You're running tens of thousands of tests. And is there a capacity issue that you can't run COVID tests, or I'm trying to figure out the gap we're trying to fill.
Sure. So the main issue that we're running into is because of COVID, we had to relocate our outpatient lab. And so we relocated them to another area on our campus. When we process all of our testing specimen, they have to then be transported from that other building back to our laboratory, so that transporting of specimens goes from one building to another building outdoors. And so one of the significant issues that we're having is because we're transporting from one area of our building to another building, we're having to take them outside, and all of that testing specimen is now being exposed to drastic temperature change. It's also a huge safety factor for our staff as we see today in the last couple of days. We have severe risks of slip and falls, which we want to keep our patients and our staff safe, as well as a pretty big risk of damaging those specimens as we transport them from one area of our campus to another.
So this is to build a causeway or an enclosed travel?
Yep. So what we're looking at doing is we would really like to relocate our temporary lab back to our permanent lab. We don't have the space currently to do that because what we've had to do is when we closed our permanent lab, we were able to expand some of our equipment that we received for testing for our COVID processing into where that patient area was. We've also had to take one of our patient phlebotomy rooms and turn it into a COVID equipment storage area because we just simply don't have enough room to house all of that. So this project would be expanding and building out on our current lab to make a new outpatient area for our patients to safely come in, get tested, and leave without having to come in and walk through the hospital or have to transport our specimens outside. It'll all be in one central location again.
Has your second priority been funded yet, and what is that?
No, our second priority that we had was our medical office building, which we were happy to withdraw earlier this morning.
Yeah. Okay, thank you, Mr. Chairman.
Thank you. Ms. Treasurer, Ms. Marshall. Further questions? Further questions? No, I thought, Mr. Secretary, you had a question. So, please.
Not a question, but I have some comments on that, if
Sure.
that's okay. Since I went up there and met with these people and went through the facility. They're right. Where they are doing this lab testing right now is in a separate building that they're having to walk out through. And also that building where they're doing the testing, the lab draws right now has got some sewage problems in that building. The bathrooms are not usable, really. And where they want to put this through to put an outside entrance into the lab to the patient area and waiting area, where they don't have to walk past all the other patients. And I looked at the analyzers that they have in there currently, and they're right. They do not have the room to adequately run these analyzers, the shelf space and stuff. So that's why I would support this.
Thank you, Mr. Secretary. And I always wondered why they handed you those cups when you went. Further questions? Further comments? Okay, we'll move to voting. All in favor of funding item 1009 Memorial Hospital of Sweetwater County, lab renovation priority 1 of 2, $4,363,238. All in favor signify by saying aye.
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 Are there nays? That motion carries. Thank you.
Mr. Chairman.
Mr. Secretary, or Mr. Treasurer, sorry.
Yeah, there's another project on here that's almost exactly the same as the one we just passed, where labs have to go from a remote testing area and into the central area, and it's also a construction project, and that's number 1087 in the Trona County Health Department for $5.1 million. So I guess in light of what we just passed and of a construction to facilitate COVID related areas, and this actually, I think, adds a lot of capacity to the Trona. We've heard that discussion earlier. I would make the motion to approve 1087 and ask for a second in the committee's favorable consideration.
Thank you, Mr. Treasurer. Item 1087, County of Natrona, the CNCHD facility relocation and expansion, $5,100,000. You've heard the treasurer's motion. Is there support?
Mr. Chairman, I'll second for discussion purposes.
Thank you, Madam Auditor. It's now fully in front of us. We've heard a little bit earlier, but I do see Mr. Nelson online. Mr. Nelson.
Thank you, Mr. Chairman. Can you hear me?
Mm-hmm.
So once again, we'd like to thank you for the consideration, and we certainly appreciate the hard work and the tough decisions you have to make. As you so correctly noted, we've, I believe, presented our case earlier this morning. And I would simply say that we believe our request is for a direct and proportionate response to the COVID pandemic, which we continue to address. I would also emphasize that the county commissioners wholeheartedly support this project, as well as the city of Casper, who is donating property for this relocation. We stand ready to answer any questions you may have. So once again, thank you.
Thank you, Mr. Nelson. I see the secretary.
Thank you, Mr. Chairman. Question for you. What percentage of this building is actually a medical clinic, and what percentage is offices?
Mr. Nelson.
Yep. Mr. Chairman, can you hear me?
We can.
So I would probably have to defer that to Ms. Kinder. I would simply state that the pared down request, the 5.1 that we're requesting, is for medical rooms and items that are directly related to providing COVID-related services. The anticipated total cost of the project is approximately $28 million. And so, as you can see, this is a relatively smaller portion of the cost. But I would ask Ms. Kinder if she had any further detail to please step up and respond to the Secretary's question.
Good afternoon.
And then Ms. Kinder, please go ahead.
Good afternoon. I just wanted to follow up, as I know that Mr. Secretary, you did ask for a lot of maps, et cetera, in the past presentations. So if you would be so kind to look at the packet, if you're able to, with the map, the drawing that is broken up into the smaller squares, the upper portion of that on your right side would be the drive-through. With all of that portion of the building, the what would be the north part of the building would be completely COVID related. And that is what the funding is that we asked for. All of the rest of the building, we do have a disease prevention clinic that we provide services for, multiple other lab kinds of things, and office space. But the area that I'm asking for support with is just that top portion. It is in the gray and kind of peach pink colors. The very top of the page is just the $5.1 million ask just for the COVID response. Can I answer any other questions in regards to that?
You're okay, Mr. Secretary. Thank you.
Mr. Chairman.
Yes, Madam Auditor.
Ms. Kinder, and I apologize because we've had a lot of conversations today. This project you project to be done in December of 25. Am I remembering that correctly?
Yes,
Or am
that,
okay, thanks.
yes, that is correct.
Further questions? Further comments?
Mr. Chairman.
Madam Auditor.
I will be candid. I'm struggling with this one a little bit, not because I have any doubt that it's a good and very necessary project. But I do think this is one where they're going to figure out how to get it done if they don't receive this money. But that's also not a good reason to not necessarily fund, saying, oh, you can figure it out some way else. So I'm inclined to give them some assistance. And actually with that, I'll make a motion to amend the motion, and then I have a few more comments. So my motion would be to reduce the favorable funding to $4.5 million.
Okay, is there support for the amendment? It's been seconded. Thank you, Mr. Superintendent. Madam Auditor, follow up on that, you said?
Mr. Chairman, sorry, my additional commentary will be on the main motion.
Okay. Ms. Kinder or Mr. Nelson, any comments?
Mr. Chairman, no, I have no further comments, and we appreciate your consideration.
Okay, thank you. Further questions? Further questions? We're voting on the amendment. All in favor signify by saying aye.
Aye.
Nays? The motion is amended. Madam Auditor.
So, Mr. Chairman, on the main motion, and like I said, I've struggled with this one a little bit, and I know we as a board, historically, we try to spread these funds into more rural areas. And as we know, sometimes Cheyenne and Casper get a bad rap because they're big and they can do it themselves and whatnot. But I had an interesting story that isn't really about COVID per se. I think here in Cheyenne, I didn't necessarily understand the reach of the Natrona County Health Department and how they serve not only citizens of more rural Natrona County, but their stretch is substantial. And for, just as an example, my father, who lives in Riverton, recently had to travel there to get a diphtheria shot to travel abroad. That is the closest place to be able to get a vaccination that he was required to leave the country. So the pull from this facility to, Fremont County, Worland, and that's something I didn't really understand. I knew the hospital took a whole bunch from those surrounding communities and is a hub of care, but I believe the health department serves that role as well. And anyway, that would be my comment. And I, like I said, I've gone back and forth on this one a bit, but I think at the reduced amount, I can support it.
Thank you, Madam Auditor. And I would add to that I know from Fremont County, a number of patients from the reservation also travel to Natrona for their medical care as well. Any further comments, questions? If not, we'll go to vote on the main motion. 4.5, that is correct. So we are voting on 1087, County of Natrona, CNCHD facility relocation and expansion, $4,500,000 is the amended motion. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Congratulations.
Mr. Chairman,
Mr. Superintendent.
I would make a motion that we fund ARPA 1059, Weston County Hospital District, for $1,099,350.
Motion's been made and seconded. We have Ms. Cadwell from Weston County Hospital. Ms. Cadwell.
Good afternoon. Been listening all morning, and board members, chairman, you've got a tough job, so appreciate everything you've done already for us and appreciate your consideration of this grant. As you may remember from the last meeting, this is a submission of a grant that we had actually submitted on the first round of the CARES Fund Act. But because of the timeline in order to get the project done, we weren't able to get it going. With this extended period of time for updating the HVAC for our nursing home, this is a much better way for us to get the system updated. The facility itself is well over 25 years old, although it's had a series of different additions provided to it, but at no time was the HVAC systems updated. And so as with older buildings, come issues with changing of filters and getting the temperatures correct and all those types of things in the facility. The new system would provide individual room filtering, which will definitely help with any cross-contamination between the residents in the facility, and will allow for more air exchanges, which will bring that fresh air in more frequently than what the current system does, and would just greatly improve our infection prevention within the facility and allow us to update our systems. I would stand for any questions.
Thank you, Ms. Cadwell. Are there any questions for Ms. Cadwell? I hear no questions here. Any comments? Comments? Clarifications? Hearing none, we'll move to vote on item 1059, Weston County Hospital District, renovations to nursing home to upgrade HVAC system, $1,099,350. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Mr. Treasurer, did you vote on that? Aye. Okay.
Mr. Chairman, before we move on, we need a clarification back on the 1248, the St. Joseph's Children's Home, where we had the tie, and you broke the tie with your no or with your nay. I think the motion was to not fund. So was it your intention to not fund? If your intention is to fund, then we need a positive
motion was it was not to fund.
Okay.
Mr. Chairman,
Yes.
I would move that we fund St. Joe's 1248 in the amount of $135,000.
Second. We voted not.
Yes, but we didn't but that motion failed. So we haven't taken action on it.
That's true.
Okay. So you're moving to fund it
I'm seconding.
at 100, did I hear 148?
35.
35, okay. That was what was on the sheet. So that motion is there. Is there a second? Mr. Treasurer, I think you seconded it. Okay, further discussion? Thank you, Madam Director, for clarifying us.
That's why most motions are always made in the positive.
Exactly.
Okay. All in favor signify by saying aye.
Aye.
Are there nays?
No.
There are 2 nays and 3 ayes.
Okay, now we're set.
Okay.
Mr. Chairman, if you're ready.
Sorry.
I'm sorry, what?
Mr. Chairman, may I have a clarification on that?
So the ayes would be the treasurer, the secretary, and the superintendent. Yeah, that's what,
That's what it
you
said.
voted in the positive.
Right.
So I'm the only one.
I decided to accompany you. I didn't want you to
Thank you.
feel lonesome.
I don't want to be.
It's a very good project, and so,
Thank you. I think we're back on track.
You want me to make
okay.
tea time?
All right.
Let it never be said that we do everything by, absolute vote. So go ahead.
Mr. Chairman, I would move that we fund ARPA number 1062, West Park Hospital District, DBA Cody Regional Health, for $2,645,254.
Okay, is there support for the superintendent's motion?
Exacted a lot of money in Cody last, didn't we? Yeah. Well, yeah, Mr. Chairman, I don't have it in front of me, but I think the auditor does, as far as how much money we put into Cody in the last round of CARES.
4.1.
Wait, I need to have a second on this first.
Oh, I'm sorry.
Sorry. I got a second from the secretary. Okay. Moved and seconded. Thanks. Go ahead.
Mr. Chairman, they received about 4.1 million from us through CARES Act.
Okay.
Mr. Chairman, I guess the question about proportionality is probably on my mind on that one. I wonder if we could have some discussion from anybody from Cody about this particular one.
And actually, Mr. Treasurer, and this may be a little bit out of order, but we've gone through a bunch of projects now, and it might be a chance for us to just sort of step back for a second, if that's okay with everybody, just to sort of kind of get a level set of where we are. There are a couple of important behavioral projects that are coming up, and yeah, I know, I recognize that. I wanted to make sure we had a chance to, you get on a roll here, Carl, and yeah. Yeah. Do you want to tell us kind of where we are, just so people understand?
Mr. Chairman, board members, within the general pot, you have a remaining $8,253,305. In the behavioral health bucket, you have $2,297,083. In the rural pot, you have $2,052,918. And in the telehealth, you have $1,181,635 remaining, for a total of $13,784,941.
Mr. Chairman,
Madam Auditor.
Beth, what was the general number again?
The general number is $8,253,305.
I need to check my math, but is there any chance that you removed that $135,000 twice? It's probably something on my end. I'll delve into it.
Mr. Chairman, on all of our tracking, all of us that are in this room tracking, we're all on the same page. So if, Madam Auditor, if at a break, we can get with you and check our numbers, if that would help you.
Okay. All right. Are we Do
Mr.
do you
Chair,
want
would
to
you give me
take a
the
mo-
number just one more time? Sorry.
Numbers one more time?
The number you have left in general?
The amount left in general would be $8,253,305.
Okay, thank you.
And I apologize, I didn't, Mr. Chairman, just run from top to bottom, I didn't have my pen and my paper ready for you. You were too quick for me.
Okay, so the general pot has $8,253,305. The behavioral pot has $2,297,083.
Okay.
The rural has $2,052,918.
Okay.
The
great.
telehealth has $1,181,635,000 or $35, sorry. Oh my goodness. For a total remaining of $13,784,941.
Thank you.
Okay, what I'm going to recommend is we go ahead and finish with item 1062. And then we'll just take a little break and just make sure all our numbers are correct. Then what I'd like to do is come back and just kind of walk through what we have left, so we know kind of where we are, if that's okay with everybody. Okay, all right. Very good. Well, we're back on item 1062, West Park Hospital District DBA Cody Regional Health AHU Replacement Project, $2,645,254. And I have Ms. Jacobs online. The floor is yours.
Good afternoon. My name is Kim Jacobs, and Cody Regional Health would like to thank you for consideration of our project. This air handler project is very important to Cody Regional Health, who not only serves the population of Northwest Wyoming, but also the millions of visitors who visit Yellowstone each year. At the beginning of the pandemic, we were forced to make hard financial decisions in order to address the COVID-19 pandemic, and our staff worked diligently to establish protocols and rework facilities in order to address the immediate needs brought about by the crisis. We work very hard to maintain our facilities so we can continue to serve our community and the many tourists we treat each year. The air handlers in question are original to the building, which was constructed in 1972, and are failing, which puts our patients and 600 plus employees at risk of COVID-19 and other airborne pathogens. The difficult financial decisions made in 2020 and 2021 due to the pandemic and the current uptick in cases that we are currently seeing lead us to request this funding so we can proceed with this necessary project. I'd be happy to answer any questions.
Thank you, Ms. Jacobs. Are there questions for Ms. Jacobs? Any questions? Any questions? Okay. Hearing none, are there any comments or clarifications the board would like to make? One more time, any comments, clarifications? Hearing none, we are now voting on item 1062, West Park Hospital District, DBA Cody Regional Health, AHU Replacement Project, $2,645,254. All in favor signify by saying aye.
Aye.
Nays? That motion carries. Congratulations. We're going to take a pause here. My watch says it is 1:20. How about 1:45 to come back together, and we'll continue. Thank you.
Which part did that last one come out of?
General.
General.
Okay.
And thanks for people for being patient. This allowed us to do a little bit of level setting. I'm going to ask Ms. Sewell or Ms. Blackwell to tell us kind of where we are. And then you'll tell us where our numbers are, and then we'll go through which projects that we are missing or vice versa.
Absolutely, Mr. Chairman. Just to recap the what you have recommended in funding at the meeting today is a little over $40.2 million. There is, I'll do approximate numbers unless you would like specifics, but 5.6 million available still in the general pot, 2.2 million in behavioral rural, a little over 2 million telehealth, 1.1 million for 11.1 million. As for the applications that still are up for board consideration, 1050 One Health, 1082 Teton Youth and Family Services, 1093 Memorial Hospital of Converse County, 1097 North Bighorn Hospital District, 1100 Volunteers of America Northern Rockies, 1101 Volunteers of American Northern Rockies, 1116 Cloud Peak Counseling Center.
And you said there was a change in the...
Yes, we were notified yesterday afternoon of a reduced request amount of $3,538,084.
Could you say that one more time? This is for Cloud Peak?
This is for Cloud Peak.
You could read.
$3,538,084.
Thank you.
Thank you. Okay.
1125 Crook County Medical Services, 1132 Wyoming Medical Center, 1142 Housing Authority of the City of Casper, 1227 Central Wyoming Hospice Program, 1228 Central Wyoming Hospice Program, 1231 Hot Springs County Hospital District, 1234 Johnson County Hospital District, 1235 Johnson County Hospital District, 1237 Memorial Hospital of Carbon County, 1241 Powell Hospital District, 1242 Powell Senior Citizens, 1244 Senior Citizens Council, DBA The Hub on Smith, 1249 Youth Emergency Services, Inc., and that was the last one I had.
Mr. Chairman?
Thank you, Mr. Treasurer.
Yeah, I was looking, there was one that I didn't get marked down either way. Where was that one? 1226? 1236? That's already been approved. 1236, right?
1236 was approved, and 1226 was also approved for no funding.
Well, this is no funding. Okay. All right. Okay.
Okay.
All right. That's.
And Amanda, this may be a bit tall in order, but as my calculations go, we've done a lot of hospitals, not so much behavioral health. Is that a fair assessment?
Mr. Chairman, that is correct. We do not have any applications from this meeting being approved out of the behavioral pot
So far.
so far.
Okay. All right.
Okay. Mr. Chairman?
Mr. Treasurer, then I'll see Mr. Secretary.
Okay. Yeah. Are we ready for motions now?
Why don't we wait just a sec, Mr. Secretary?
Thank you, Mr. Chairman. I would like to move both at the same time, 1100 and 1101. 1100 for the amount of 901,863, and 1101 for 608,608. And in those, of those amounts, 250 at 1,100 going to telehealth and 100K for 1101 going to telehealth. If that isn't too confusing.
Mr. Chairman, Mr. Secretary, could you please repeat all of that from the beginning?
Absolutely.
That would be much appreciated. Thank you.
Okay, I tell you what, let's first off, on 1,100, the amount on the motion is 901,863. And of that, 250 would be for telehealth.
250,000.
Right. And on 1101, the amount is $608,608 with 100,000 going to telehealth.
Second, Mr. Chairman.
Oh, it's been moved and it's been seconded. Ms. Treasurer, sorry for jumping out, but we're where we are. It's been moved and seconded. Madam Auditor, would you like to speak to it?
Just a clarification, I'm assuming the secretary meant that the primary pot, the primary amounts of those monies would come from the behavioral health allocation. Okay.
That's correct. Just
to be clear.
take that amount off for the telehealth. Everything else would be in that mental health.
Okay. Does that clarify everything?
Confuse the heck out of it.
Okay. Thank you. So that motion's been made. Is there anyone here to address a
Hi,
Thank
Mr.
you.
Chairman, members of the board, thanks for having us. My name is Dr. Amy Foster. I am the Vice President of Behavioral Health for Volunteers of America Northern Rockies. I also believe online we have Heath Steele, who's our Chief Operating Officer up in Sheridan. I appreciate the opportunity to talk about these projects that we're requesting funding for. The priority project in Sheridan is our crisis stabilization unit to be added onto the Sheridan campus, and that was the one that we were requesting approximately $1.8 million for. This is not a service that exists in the entire Northeast region of Wyoming. And as many of you know, the need for crisis services in our state has increased drastically as a result of the COVID-19 pandemic. Behavioral health needs have skyrocketed, and the severity of the population that we're serving in terms of mental health needs has increased significantly. And so the crisis stabilization program that we're proposing to add to our Sheridan campus would allow for transitional care for those who maybe either don't meet criteria for Title 25 hospitalization or who are coming out of Title 25 hospitalization and need some additional monitoring before returning to their independent communities. A large portion of this will be, as Mr. Secretary stated, telehealth. Due to the national mental health provider crisis in our state, we use telehealth services for med management so that our patients can meet with prescribers in different communities, as well as assessments, right? We use our behavioral health specialists across from Cheyenne all the way up to Sheridan to ensure that we're getting people admitted into our programs appropriately. So again, that's our crisis stabilization program. There's not a service that exists like that in the Northeast region. And so we look forward to the opportunity to be able to provide that to our community. It is a regional service, which means a large catchment area in the Northeast portion of the state would be served by this program. 1101, the second project that we're looking at here today is our women's residential treatment program. And that would be to fund an additional 12 beds of women's residential treatment, again, on our Sheridan campus. Much like I mentioned before, the severity of the patient population that we're serving and the need has increased drastically as a result of the COVID-19 pandemic. And so we're looking for an opportunity to expand our services in that regard. So again, I appreciate your willingness to consider our projects and would just make myself available for any questions. As I mentioned, Heath is also online, our Chief Operating Officer, so he may want to jump in as well.
All right, thank you, Doctor. Heath, is there anything you'd like to add? Mr. Odenfeld? I see Anna Edwards.
Anna Edwards is our Senior Director of Grants, so.
Okay.
Mr. Chairman.
Oh, that would be Heath.
No.
Mr. Chairman, Slib Board, sorry, the mute was slow coming off. I would just add that these projects are a direct response to COVID-19 impact. The system has been greatly, we've seen significant placements, and as an agency that was open and provided safety net care to the entire state throughout COVID, and particularly the 11 counties, including Weston, Crook, Goshen, and Platte that we deliver care for. We believe these programs are critical in nature to maintaining that safety net. We had more women and children through our program than we had beds for during the COVID pandemic. And at that time, we had to rent trailer houses to be able to hold COVID positive clients and overflow. And as our third-party assessment demonstrated, that is not a long-term solution. So adding on to our 2 current existing buildings is the best case scenario out there to continue to meet Department of Health, Department of Corrections, and Department of Family Services needs. I'm grateful for your time today. We are shovel ready. We do have the plans drafted and have looking at an estimated completion in early 2024. And we do have strong legislative support for this in the Northeast region. Thank you for your time.
Thank you, Heath. This is probably not the correct thing for the chair to do, but let me just ask an informational question. We have allocations lined out here, and Carl has done a great job of outlining those. We had an earlier award that allowed for a little bit of allocation between both. And I guess I'm, recognizing that we're not funding you fully in either of these. I guess the question is, would that flexibility be helpful to you? I'm presuming that you'll be able to complete these projects, both of them. Does that make sense, Mr. Secretary? You know what I'm saying?
Yeah.
So Heath, what's your thought?
Specifically to the question, we will be able to complete these projects with the support from the Slib Board.
Okay, so you don't need the flexibility. The allocations as outlined are fine.
Allocation between the 1100 and 1101, just for clarity.
Yes.
I would absolutely like the flexibility between the two. And that way as we value engineer these projects and bring them together, we've got a little latitude.
Okay, and as I say, that's not appropriate for the chair to do, so I just bring it up.
Well, Mr. Chairman, do we need to amend that motion a little bit to allow them the total amount and let them work it out with Osley if they want to allocate that a little differently? But
it's your motion, sir.
Yeah, then if the second would agree with that, then we'd go ahead and make that motion to allow them to be flexible with the total amount to Volunteers of America, and they can work with Osley as how they want to appropriate those two.
Sure. And the seconder, I think, was the auditor. Is that correct?
Yes, Mr. Chairman, I'm good with that.
So that's good. Any further discussion?
Mr. Chairman, I have a question. A very ignorant one. So we recently approved a empath project within the Sheridan Hospital. Help me understand how this is different. And again, not being my sort of line of work and recognizing that's probably a silly question, but help me understand the difference.
Sure.
Or if there isn't one.
Yeah. Mr. Chairman, The difference between these programs, as I see it, is the Empath program is a hospital-based mental health program, essentially adding Title 25 beds to the community hospital. The community-based crisis stabilization programs that we offer are not, they don't hold Title 25 clients. These are people that are not necessarily at an imminent risk to harm of self or others, maybe can be stabilized with additional monitoring in the community. It's also a respite or step down process from the hospital. And we know that people coming out of hospitalization for behavioral health needs are at a higher risk in the days, weeks, months following that hospitalization for suicide. And so that step down process to a community-based crisis stabilization program allows for that additional monitoring, wraparound services, connection to outpatient services, so that we can ensure that they're followed and getting the care that they need moving forward. Additionally, in crisis stabilization, we use intensive case management to help, hopefully, get these individuals connected with housing resources, other community-based resources, food, shelter, clothing, those types of things, and in addition to meeting their mental health needs. So the programs are different. They're definitely, we work in close collaboration together. Like in Cheyenne, for example, we have a crisis stabilization program, and we work closely with Cheyenne Regional to make sure that that step down process occurs. Thank you.
Thank you, Madam Auditor. Further questions? And Mr. Superintendent.
Thank you, Mr. Chairman. Just a quick question. It might reveal my ignorance on this. You would think I would know this, but I don't. The telehealth work, is that counseling just on the telephone, or does that include Zoom, Google Meets, and all of the above?
Yeah, we primarily use Zoom for our telehealth
Okay.
needs, and we put tablets in a variety of different locations. So, for example, in our Johnson County Sheriff's Department, we have a tablet so we can do jail-based assessments. Johnson County Hospital, we do the same. Banner Hospital in Torrington, we have tablets there. And so it creates an opportunity for us to meet with the patients who have a behavioral health need for assessment and make a determination in collaboration with those partners for best level of care for those patients.
And does it include telephone?
We do
work
telephone
as
as well. It's not the preferred method of telemedicine. You know, laying eyes on a patient always provides some more information, but we can accommodate that as needed.
Thank you, and thank you for the work you do.
Yeah, thank you.
Further questions? Further questions? I don't hear any. Doctor, thank you very, very much. I see, is Heath wanting to say something more?
I thought I saw Anna's hands up, Mr. Chairman, but I'm not sure.
Okay. Very good. Well, thanks. What's the pleasure of the board? All in favor signify by saying aye.
Aye.
Nays? Congratulations. Thank you.
Yeah, Mr. Chairman?
Yes. Mr. Treasurer.
I would make a motion on ARPA 1082 HHS Teton Youth and Family Services, Teton Youth and Family Services Safety Upgrade in the amount of $2 million.
Second.
Mr. Treasurer, that is a great motion, and he's made it, and the superintendent has seconded it. Is there any discussion? Any discussion? Is there anyone here from Teton County or online? Oh, there we are. Sorry, we kept you here all day.
Better? Okay. I'm Sarah Cavallero. I'm Executive Director of Teton Youth and Family Services. For 45 years, Teton Youth and Family Services has been providing critical behavioral health services to children and families in Wyoming. During the start of COVID, our community's calls to the Department of Family Services making reports of abuse and neglect went from an average of 16 to 18 calls per month to 2 for the month of April 2020 and 3 for the month of May of 2020. The reduction in reports was directly linked to the school closures, as teachers and school social workers make up 80% of our reporters. Without direct regular contact with children in the school, the factors for families entering crisis situations increased. TYFS has seen a 40% increase in uses exacerbated by COVID. Our target audiences are youth ages 12 to 18 who demonstrate behaviors and attitudes causing crisis within the home. These youth often reveal issues of trauma, abuse, or neglect, and COVID has impacted our numbers significantly, requiring services at higher levels of care than ever before. As a result of COVID, we have seen a 75% increase in forensic interviews for abuse and neglect. We've seen a 61% increase in therapeutic respite services for families at risk of abuse or neglect, a 46% increase in need for residential care for kids, and a 185% increase for youth that are actively suicidal. I started out working at Teton Youth and Family Services in 2001, and over my career, most of the time, the kids that we're seeing are representing behaviors that are focused externally. They're throwing chairs, they're breaking walls, they're breaking windows. As a result of COVID, what we've seen change is that our kids have turned inwardly. They've become suicidal, they're self-harming, and they're very quiet about how they're hurting themselves versus expressing externally. I would much rather see them throw a chair or whatever, but it's much harder to see the pain that's happening when they're doing it very quietly. As an example, the 17 youth that we served over this past month, all 100% of them had the primary presenting reasons for services as self-harm, suicidal ideation, depression, and anxiety. We have also seen 2 9-year-olds present to us at the ER that were suicidal. This is the youngest I've ever seen kids presenting with this level of mental health need, and it's pretty frightening. As COVID has intensified and worsened youth behavioral health, it's exemplified by our need. Our services are effective. 85% of the kids that we serve don't go on to higher levels of care. We have estimated a savings of $4.3 million a year in avoided costs by providing these services. Our facilities, however, have not kept up with the increasing severity of need. We currently operate with facilities where youth are removing light bulbs to self-harm, and we need safer facilities to provide our highly effective services. In the fall of 2021, our board of directors received reports in this change of client needs, along with an incident report from the Department of Family Services identifying the root cause of the incident as facility malfunction. In response, the board voted to move forward with facility improvements to ensure the safety of our clients. We began working immediately with architects and builders to design improvements that would address all the known safety issues. In March of 2022, our board of directors voted to launch a $15 million comprehensive campaign with the goal of securing $10 million in private funds and $5 million in public. This past November 8th, we had a SBLC ballot item of $2 million that received the second highest priority of 15 projects. Additionally, since the launch of this campaign on July 31st, 2022, we have received $7 million in private commitments and pledges. Our application for ARPA funds would leverage $10 million in private funding and an additional $2 million in county public funds, or the equivalent of a 1-to-4 match. Our Van Vleck Crisis Shelter Group Home and Suicidal Holding Facility is at least 52 years old, with internal electrical systems dating back to when electricity first came to Jackson. An entire redesign to fortify the safety elements is required. A more open floor plan to monitor clients more safely, a suicidal holding room in the building will reduce the need for independent, costly facilities, while allowing for the youth and their family members to be segregated within the rest of the facility. Anti-ligature elements alongside more open floor plan and built-in observation areas will be required due to a higher level of acuity of those that we're serving. Since the start of COVID, youth in need of crisis services have risen dramatically, as well as a need for safe facilities. To serve their needs in an environment that is therapeutic and can address increased levels of supervision, changing academic needs, and client safety, all due to COVID, is an essential need for Wyoming children. ARPA Health and Human Service Infrastructure Funds will help support the construction necessary to improve the safety and facilities with the more open floor plans, safer utilities, and fixtures. Thank you for your extensive time and consideration for the critical needs of children and families of Wyoming.
Thank you, Ms. Cavallero. Are there Are there questions?
Mr. Chairman,
Madam Auditor?
are you able to move forward with the reduced amount of funding that's proposed?
I mean, it's about where we put our time, and where we've been putting our time is where, yes. And I think it's, the message that we've been really trying to show is that this is a public-private partnership. That's how TYFS functions, because the state doesn't have facilities, our town and counties don't have facilities, and we really tried to design this whole project so that there were equal parts based on the users that were using it. And so while a reduction in funding, we can figure it out, we still have a lot more to raise, and we still have a private amount of goal that we still need to raise to be able to make sure that we are able to execute the project.
Thank you.
Thank you. Further questions? Further questions? Further questions? Hearing none? All in favor signify by saying aye.
Aye.
Congratulations. Thank you.
Mr. Chairman?
You guys are right on time with each other. This time I'm going to give it to him first. Sorry.
Okay. Okay. This is a small one. I think it's just been overlooked. It's the number one, I guess, request from the Bighorn area here, Hospital District, North Bighorn Laboratory remodel. 1097. And it's for $214,500. And I guess I compare it to the lab renovation up in Sweetwater County. I think it's a bargain. And it checks one of the boxes of trying to get something done in that Bighorn area that's really rural. And I think it would, I'm not sure whether this goes under the rural area, because I guess it's billing codes and things like that define that. But so I'm not sure where to take it out of, Mr. Chairman, but staff can tell us. But that's my motion, is for that to do pass.
And that motion has been made. Is there support? Go ahead.
Second.
It's been seconded by the Secretary of State. You know, quite frankly, it could come out of rural pretty easily if that's what we wanted to do, but so. It's anywhere. I mean, so is there anyone that wants to speak to the lab remodel in North Bighorn Hospital District? Anyone? Okay. I hear none. Don't see any. Mr. Bump, just double checking. We're good. All right. Any questions, comments?
Mr. Chairman, just clarifying where we're taking it from?
I'd let staff tell us the best place that won't impact the mental health. That won't impact the mental health things we're doing.
Ms. Sewell.
Mr. Chairman, I believe it could come either out of the general, or if you wanted it to come out of the rural, there's funds there too.
I'd go rural, because, you know, you'd have to have rural mental health and click 2 boxes, so we'll let the general.
All right.
Stay alone.
Out of rural. Very good. Further conversation, comments? All in favor signify by saying aye.
Aye.
Motion carries. Mr. Secretary.
Thank you, Mr. Chairman. I'd like to move 1050. That's One Health, the Fitch Building Remodel Project, but at a reduced amount of $2,148,656. I originally had that at the full amount, but we don't have it right now. $2,148,656, and that would be in rural.
He cut 2 million off the total number. So that motion's been made. Is there a second?
Second.
It's been seconded by the treasurer. Is anyone here from One Health? Up, please, come on up.
Is this on already? Thank you.
Yes.
I'm Juanita Sapp. I'm a physician, and I'm here to introduce you to our clinic, as none of you could make the site visit. And then my Chief Financial Officer and Chief Executive Officer will give the details of our grant proposal. Heritage Health Center started 7 years ago on paper, and I was able to return to Powell as a physician to help be the first physician in that clinic. It was my home stomping grounds. I was born and raised in Powell. My family goes back to 1878 and running a stage station there outside of Powell between Billings and what was to become Cody. When we first started, it was myself. Our chief executive officer was also the receptionist, the janitor, the jack of all trades, and then we had a nurse. In those 7 years that we've been there, we've gone from our 3 employees to 28 employees, and we've expanded into Grable and Lovell with primary care clinics. Heritage Health Center provides not only primary care services to these 3 communities, but we also provide mental health services. Our behavioral health provider was the second provider we hired. We were so in tune with wanting to provide for the whole person in our clinic. As a federally qualified health center, our mission is to provide for the community, every member of our community. So we emphasize that our patients, our whole patients, we need to be able to provide their whole health, not just their physical health, but also their mental health. In this last year, we had 9,000 plus visits to our clinics in the 3 cities, towns, and provided for 3,000 unique patients this year. Over the course of 7 years, we've had more than 9,000 patients receive care with us. We do have a sliding fee scale, but we also see patients under Medicare, Medicaid, private insurance, and those who are underinsured. Those who have no insurance or are underinsured can be seen in our clinics under a sliding fee scale for as little as $0 based on their income and family size. We have also, besides cooperating with clinics, starting clinics in Grable and Lovell and providing mental health services there as well, we cooperate with the Powell School District to provide mental health services in the schools, in the school buildings themselves. And we are in the process of developing a school-based health clinic with the Powell schools. This is not a unique model. I believe that Gillette has had a school-based health system for some time, and we're going to start a school-based health clinic with the Powell schools. We do provide telehealth services, especially during the pandemic. Some of our patients that depended on us were coming from Washakie County, from Hot Springs County, definitely Bighorn County. And it's difficult to get through the weather sometimes, or just to have the money to drive up to see a provider for 15 minutes to then go home. So we did expand our telehealth services during COVID, and we continue to use those for both mental health as well as for primary care. We also use our telehealth devices to communicate between the 3 clinics. If there is a provider that's unavailable for some reason, weather, illness, and can't get to a clinic, that clinic can still function because of our telehealth services to other providers in our system. Unfortunately, we are now outgrowing. Our original building was a dental office that we retrofitted, kind of. We put up some temporary walls. Within a couple of years, we moved to a second building. So we were in 2 buildings. Now we're in 3 buildings in downtown Powell. We also have the clinic building in Grable, the clinic space in Lovell. All of them are at maximum capacity at this point in time. We cannot add any more staff. We have openings for 4 more with not a place to put a chair for them. And so I'm going to turn this over to my Chief Executive Officer and Chief Financial Officer so that they can fill you in on the details. Thank you for hearing me. I appreciate your
Thank
attention.
you very much. And I'm assuming that's Ms. Mild?
Yes, Ms. Mild and Dr. Mark.
Okay,
Thank you.
okay, thank you. The floor is yours, Ms. Mild. And
Okay, thank you. Can everybody hear me all right, just to make sure?
yeah. Yes, we can.
Well, I echo everyone else that's been up before you today. Thank you guys so much for the opportunity that you're providing to all of us within this. Much of what I have to say, you've heard from one application or another, and as Dr. Sapp very eloquently put out, we kind of mark almost every box. We do mental health, we do telehealth, we do primary care. We actually do a lot of labs as well. And COVID-19 is in the middle of absolutely everything that we do in the clinic on a daily basis. Since the pandemic, growth at the clinic is 75% more than what it was at the time of the pandemic. So since we have started this venture, we all have started this adventure of COVID-19, the demand for our services has grown exponentially. I know we've touched on a lot of things in regard to telehealth. We are really trying to be at the forefront of that. We saw a need. We have 2 clinics in outlying areas. And sometimes, as others have referenced today, it is really hard to hire medical staff at different areas. So in order to be most effective throughout the entire basin, we have developed processes that allow us to see people where they are at, and also allow our medical providers to be most efficient wherever they happen to need to be that day, whether it's on site or via telehealth. Our telehealth capability actually goes a little further than Zoom. We've invested in providing telehealth care through a system called TidalCare that actually allows a provider to hear a heartbeat and see in an ear and through a throat. So the exam quality that they're being provided with through telehealth is really much more extensive than just a phone call or video call. It really is good, as good of healthcare as you can get via telehealth. And every provider I think that we ever talk to, obviously the best care is always in person, but we all know that that's not always an option in our remote state in rural areas. The building, the choice to go with the Fitch building was not something that was undertaken lightly. We've actually been looking at space for years now, and building out a new building was significantly more expensive than purchasing a building that was already 11,000 square feet. And based on 2 outside reviews, we used a outside consultant group to make sure that the space needed would meet the growth of what the health center had to do, and that was a group out of within our justification, the group out of Colorado. And so they made sure that basically the programming or the amount of space we would need to include providers, nursing staff, our behavioral health staff, that the Fitch building was adequate for that kind of growth. Additionally, we had an architectural firm review it that included mechanical engineering, mechanical, structural, and architectural. They also did the roof and the exterior. And we did that before the purchase of the building, because obviously it was a very large purchase. We have been saving a long time. And we are financial stewardship is very important to us, and it's worth all of that to make sure that the building we purchased was going to be something that we could use long term, but it was the most economical choice for us within the area. It also sits right next to our high school, which will really help enable and enrich that ability to provide that school-based care. Especially in a world where we are seeing so much need in our schools. We've just seen it amplified so much since the pandemic. So to be able to further that relationship is really important to us. And within that packet, you saw a letter of support from our superintendent that could echo those sentiments. So The inspection did come back. It was in excellent condition. It was a good value. It fit all the boxes for what we needed. So I guess with that, I think I hit on all the points, hopefully, that you guys have kind of asked about with other applications. But with that, is there any other questions I can answer for the board to help you better understand our project and us as a group?
Thank you, Ms. Mild. I think the Secretary of State may have a question.
Thank you, Mr. Chairman. In your talk here, you spoke quite a bit about telehealth. So what would you say if you could put, looking at your original ask on that, what would you say the dollar value of a percentage, what kind of dollar value would you put on telehealth?
The value for us is exponential. I mean, honestly, like you could say 900,000 to $1 million, just because what it does is it enables us to be throughout the basin, even beyond that into people's homes. So that equipment that we all have, we have to have the staff on site to be able to do it, but our patients actually can download an app from their home, wherever they're at, and they can see the patient via a phone. So really, it is huge within the realm of our project. So, and we did not ask for that within, the original application. We had looked more at that narrow eligibility funding, but, in this sense, I believe that we would fit into the telehealth funding, and that Powell clinic has to be the hub for all of that, because it's got to have the support of that staff. It's got to have nursing staff. It's got to have MA staff. It's got to have all the staff that you would need for an actual visit have to be present somewhere to make that visit whole and to make it effective for the patient. It also includes, the front desk staff maybe troubleshooting with the patient a little bit before their visit to make sure that their technology is working correctly and that provider has a really smooth visit. So, the value for us is much more than the actual dollar figure, because it really makes us effective in such a robust way and so much different than, your normal brick and mortar type of clinic.
Thank you, Ms. Mild. Just follow up, and then you have a question, Auditor, but go ahead, Mr. Secretary.
Mr. Chairman, since, they really hit on that a lot and everything, I would like to amend the motion if that would be okay with with my second. I'd leave the same amount here in the rural health, but add 500,000 for telehealth.
Okay.
So that'd be 2648.
What was your amount coming out of rural?
Rural is 2,148,656.
So, Mr. Chairman, we don't have that much left in the rural bucket.
You got about 1.7 here.
Mr. Chairman,
Madam,
I calculate $1,838,418 in rural. And then the difference of $310,238 to make up the total $2,148,656 I had in the general bucket. So
But if we take 500, we're still 800,000. We can pull and add 500,000.
So how, let's do the breakdown. Sorry,
with the motion of $2,148,656, that breakout would be $310,238 to general, and rural, which would allocate all of the narrow $13 million, is $1,838,418.
How much in telehealth now?
Telehealth has available $831,635.
not counting the 500. that I-
Correct.
Yeah, 331 if you took 500.
Mhm.
So is that your motion
That,
amended
uh,
that we can then go to the seconder with?
yes, Mr. Chairman, that we would add 500,000 that would just go to telehealth, but that we leave the original 2148, 656 in rural. So rural's full, mental health is full, and we would have 300 something thousand left in telehealth. 310.
So the total grant would be 2,648,656?
Correct.
Who seconded that?
So let me see, the seconder of that motion was the treasurer, correct? So, Mr. Treasurer, what,
Yeah, so I understand what we're doing here. We're leaving the same math that we had from our staff, taking 310 out of the general and the sweeping the rule down to 0. And then adding 500 out of the telehealth, taking it down to 331. And moving this up to 2,648,656. Okay, second is fine with that.
okay, that's the motion that's on amended on voluntarily and accepted by the second is before us. Is there any discussion?
Mr. Chairman,
Madam Auditor?
I had a question for the CFO and or other parties that were here. We've taken a substantial chunk out of the request, and I want to know how that affects the project. Does it kill the project overall, or can you make an adjustment where you can still get that done? Recognizing that giving you some money, but not enough to get it done is maybe not a productive venture.
No, we can definitely move forward with that. And we have actively been looking and continue to look, and I feel confident we'll be able to find some other funding to finish out the project as scheduled.
Okay, and then I do note that David Mark is on to talk about this as well. And Mr. Mark, I'm sorry that I was going to call on you beforehand, but we kind of got into.
Oh, yeah.
Please,
Thank
go
you,
ahead.
Mr. Chairman, and members of the committee. I have nothing to add to what my colleagues have eloquently stated, but stand ready to answer questions as needed.
Thank you very much. Okay, further questions? Further questions?
Chairman, one question. Do you want the additional 310,000 and some change coming out of the general pot, or would you like that coming out of the telehealth pot?
Mr. Chairman, I think we took it out of the general. I don't know whether we can take it out of the telehealth. There's money to do that. You'd have about $20,000 left in the telehealth. That's up to the maker of the motion. And, yeah, and whoever else wants to chime in.
Yeah, the general can be used for almost anything, but anyway, go ahead.
Mr. Chairman, I believe we still have one more coming for the telehealth that will help finish that off.
All right.
So I think we just leave it the way it is. Yeah, take that out of the general.
Okay. All right, if that be the case, is there any further discussion? Any other questions? Any clarifications? Hearing none, all in favor signify by saying aye.
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 Is there a nay? There are no nays. That motion carries.
Mr. Chairman,
Mr. Superintendent.
I would like to make a motion that we fund ARPA 1093 Memorial Hospital of Converse County for $1,311,593.
Okay. 1093, Memorial Hospital, Converse County, protection of patients and staff from COVID-19, 1,311,593. 593, superintendent's motion has been made. Is there support for the motion? Is there support for the motion?
All second for conversation, discussion. I had thought that we just pumped a bunch of CARES money into them to do exactly this in Converse County. Can staff or auditor tell me?
4 million.
Yeah, Mr. Chairman, we put 4 million into that in the CARES thing, and that's what I was discussing earlier today in one of the other ones where we had to, we gave them money to put on other exits and other entry points and segregate the waiting room from the rest of the hospital so they could have a different entrance to bring in patients and things. So I'd like to hear from somebody from Converse County to tell us what was left undone in their $4 million project.
And I note there's a Mr. Or a Dr. Dan Meyer online.
I am. Can you hear me?
Yes, we can hear you.
Okay. Well, thank you, Mr. Chairman, board. It's been a long day. Appreciate you all. I am the CEO of the hospital. And I just want to note this project is actually a very slimmed down version of the original project we submitted, which was almost a $4 million project. And this is now down to 1.3 matching. And so, that is correct that we received money in the first round. That was specifically for our third floor, our inpatient floor. This project focuses on the second floor of our hospital where a huge amount of activity happens. And the challenges involve the HVAC on the surgical side and really the fact that we have 4 entrances to a single area that are not easy to divide or partition up. And so we're trying to really separate the sick patients from the ED and lab side from the other. So, and I guess I'd also want to point out, I know we're a small county, we're the 13th largest of the 23 counties. But some of you may have seen the report that the University of Wyoming Center, the School of Business released, or the College of Business released, about the economic impacts of hospitals and nursing homes at a county level. And in that report, it shows that even though we're the 13th largest, our economic impact is the 5th largest in the state. And the reason for that is because there's a lot of activity coming towards this hospital. So this particular hospital is not commensurate with the size of its hospital. In fact, our economic impact was $175 million on the county, which is a startling amount of money relative to our size. So I would just want to point out that there's been discussion throughout the day about the equitable distribution of funds. This 1.3 is our only ask for a county that is operating in 7 different counties, and there's a lot of activity on this second floor. So be happy to answer any other questions, Mr. Chairman.
Thank you very much. Further questions? Further questions? Okay. Madam Auditor, anything you want to fire? Hot tamale? We can add some over there too. Is there anything more on this conversation topic here? If not, all in favor signify by saying aye.
Aye.
Nays?
No,
No, I changed mine to a name.
because it was a due fund.
Yeah, sorry.
Yep. Okay, so let me go again. What I have is the superintendent voting aye, the secretary voting no, the auditor voting no, and the treasurer voting no. Is that correct? Okay, that motion that motion fails.
Mr. Chairman,
Yes, Madam Auditor.
I would move, and I want the capable ladies of OSLI to make sure I'm on track here. I would move 1116 Cloud Peak Counseling Center in the full amount of $3,538,084 with the following breakdown. Mental health, 1,136,612. Telehealth, 331,635. And
Mr. Dammeier, your microphone is on, or doctor, I'm sorry, if you could mute it, that'd be great, thanks. Sorry, let's walk through this again.
so the breakdown, Mr. Chairman, to the mental health bucket would be the remainder that sits there of 1,136,612. The remainder of the telehealth bucket of 331,635. And the balance of 2,069,837 coming out of the general pot.
Does that comport with your numbers?
Yes,
Ms.
Mr. Chairman.
Okay, you've heard the motion. Is there support for the auditor's motion?
Second.
It's been seconded by the Secretary of State. Is there any discussion? Is there any discussion? Do we have anyone wanting to address the board? I will note that the commissioners wrote us a letter of recommendation from Washakie County. Yes, please. I'm sorry. I'm sitting here looking at the.
I was just going to let you finish. Thank you, Mr. Chairman. I'm excited to be able to present on this project today. You did get a letter of support.
Can you identify yourself, please?
Yeah, I'm so sorry. My name is Mary Johnson. I'm the CEO of Cloud Peak Counseling Center, and we are the regional crisis stabilization serving the Bighorn County in that area. So I'm happy to be here. Thank you for your support. I want to acknowledge our CFO is online. She doesn't want to speak, but she's been doing a lot of background work, so I want to thank her for her support today. Cloud Peak Lighthouse is what I think is important to point out today. We've heard a lot about crisis stabilization from Dr. Foster, and so I'll mirror some of that. But I think what's important to point out regarding the mental health need is that when we move through something like a collective trauma, such as a pandemic, the mental health crisis typically comes after the fact. So as we move away from the emergent need, we're seeing this influx in mental health need. And so that's just exacerbated. We see that in our numbers at Cloud Peak and at the Lighthouse. We see an increased severity of clients. And we're also seeing clients that we wouldn't typically see in crisis services. We're seeing mental health problems coming from care providers, from nurses, doctors. We're seeing those people now needing services where we hadn't seen that before. So I'm risk averse, and so I would stop there and answer any questions you might have.
Thank you very much. Madam Auditor.
Mr. Chairman, yes, if you could just talk a bit about geographically, how far is your reach?
Yeah, of course. Thank you, Mr. Chairman, Madam Auditor. I would say that last fiscal year, our Crisis Stabilization Center served 10 different counties. This year, we've total served 6, and we are aimed to probably double that in the next couple of months. So we have an extensive reach. Typically, the Bighorn region consists of Fremont County, Hot Springs County, Washakie County, Bighorn County, and Park County, but we do take other clients from different counties from the state. I would also make mention that our mental health services for med stabilization, for our medication provider are all done via telehealth.
Thank you. Further, quick question on substance abuse. In that region of the state, are there many centers that do substance abuse?
I wouldn't say there are many. We're one of the only centers that provides outpatient substance abuse treatment. And in the Lighthouse specifically, what this project is about, we also see a higher need for substance abuse services.
Thank you. All right. Any further questions? Hearing none. All in favor signify by saying aye.
Aye.
I think you got a unanimous vote. Is there a nay? I think you got unanimous vote. Good job.
Thank you, Mr. Chairman.
Thank you for your travels down here, by the way.
Absolutely. It was
All right.
well worth it.
All right, thank you.
Mr. Chairman?
Madam Auditor.
Well, I should have found it before I opened my mouth.
It's late in the day.
Mr. Chairman, I would move favorable consideration for ARPA 1227. That's this one of the Central Wyoming Hospice programs, $360,000.
Second.
It's been moved and seconded moved by the auditor, seconded by the Secretary of State. Is there any discussion on this? Any discussion? Is there anyone online that would like to address the board on item 1227, Central Wyoming Hospice Program, Central Wyoming Hospice, Converse County Expansion, Priority 2 of 2 for $360,000? Anyone? Anyone? Any questions, clarifications, or anything else? Hearing none, all in favor signify by saying aye.
Aye.
Nays? That motion carries. You were an aye. Sorry, I thought I heard you.
Mr. Chairman.
Yes, Mr. Secretary.
Just because we are coming down to the wire, I want to just double check, make sure Osley's got the same numbers I have, which in rural, I'm showing that we're 310, 238 over.
Mr. Chairman, we took, yes, that was over and we applied that to the general pot.
Right, that's right, but yeah. And then in the mental health, I'm showing 5,902,576 over.
Mr. Chairman, Mr. Secretary, we don't have the total over, we have the what's remaining, which is 0.
Okay.
And so anything over was taken out of the
Right.
general fund.
And the mental health, the telehealth, I'm showing that we are at exactly 0.
Yes, sir.
And so I am showing on my numbers that we have a total left of 867,976.
Mr. Chairman, Mr. Secretary, that is what we have too.
Okay, then, just so everybody's aware as we're hitting these last couple.
Mr. Chairman, can we wait a little while and take a look at what's left there and see if there's any priorities?
I think that's probably in order. If there's.
So can you go through and tell us which ones are still left on the table?
Yes, sir. Mr. Chairman, the remaining, and Mr. Treasurer, the remaining applications you have not considered today is 1125 for Crook County Medical District for their facility remodel, a $10 million request.
Just
$1 million or
10 million.
Yeah.
just a second on that one, if you don't mind. On 1120, no, let's see. Hold on. 1093, that was, that one got voted not, but We didn't vote
It-
not to fund it, or we vote that thing clear down?
It failed for
Okay.
lack of a second.
So that one's gonna go right. Okay, thank you. Sorry.
The next application would be 1132 Wyoming Medical Center Behavioral Health Unit for $3,313,577.
That's in Casper, is that right?
That is, I believe that is Casper, yes.
Okay, all right.
Application 1142, the Housing Authority of the City of Casper for Willard Envision Center for $2.5 million. Application number 1228, Central Wyoming Hospice Program for expansion of Central Wyoming Hospice, $752,000. 1231, the Hot Springs Hospital District for their clinic remodel and expansion in Thermopolis for $1.5 million. 1234 for Johnson County Hospital District, their medical center addition for $737,800. 1235, once again, Johnson County Hospital District, inpatient remodel for $869,000. 1237, Memorial Hospital of Carbon County, infectious control and COVID response plan, $551,000. Powell, application 1241, Powell Hospital District, for their OR renovation in the amount of $630,249. Oh, 94, sorry. 1242, Powell Senior Citizens A Go-Go Inc. for their new building. Request is $4,021,525. 1244, Senior Citizens Council DBA The Hub on Smith, expansion project for $3,007,618. And 1249, Youth Emergency Services Inc., driveway and parking lot for $630,046.
Okay. Mr. Chairman, have we got anything in Thermop yet? I don't know whether you got anything in that Hot Springs County or not that's been funded.
I don't believe we've done anything there or in Johnson County.
Yeah, you've got some
Oh,
Johnson
we did
County
the-
ones, yeah.
We did the ambulance.
Ambulance, yeah,
The
that's right.
ambulance and
That's all we
None
did.
from Uinta.
none from Uinta? Did Uinta have any requests in?
No.
No,
Okay.
they spent enough on the hospital.
Do we have any, Mr. Chairman, could we ask if there's anybody from Thermopolis here to talk about their program or what they're trying to do?
I see Mr. Alwyn or Alwyn.
Yes, good afternoon. This is Scott Allen. I'm the CEO for Hot Springs Health.
Very good.
And yeah, thank you very much for the opportunity to speak today. I also have Heath Overfield, our former board member and CEO of Engineering Associates, online as well from here at Thermopolis. Appreciate the chance to visit virtually with you. We are a district-owned organization that is funded and utilized by our community. The project application we have before you is to expand our current home-based rural health clinic. This project is crucial for the future of our clinic safety and operations for a variety of reasons. With our expansion, we're preparing for future pandemics as well as current communicable diseases and illnesses by allowing us to isolate patient types to certain pods and preventing cross-contamination or infections. This isolation will also help prevent having to conduct testing outdoors at patients' automobiles and rather be able to provide a controlled, safe space indoors for testing and evaluations. Additionally, our current clinical space has very little space for clean versus dirty personal protective equipment. and little to no space for additional supplies needed for patient care for individuals with COVID and other contagious illnesses. We're one of the only facilities with a rural health clinic providing a physician residency training program through the Rural Track Training Program. And as of today, we have two full-time residents that are training and will provide future crucial healthcare for rural Wyoming residents, especially during times like this when it is so hard to recruit medical providers to small rural areas. Our current clinic space is very limited and does not provide ideal space allocation for that teaching program. And so by expanding, we can add collaborative space for teaching and training. And we are very proud of the residency program and proud of the fact that we are supplying rural Wyoming with excellent physicians to care for our communities. Additionally, with this expansion, we will have 3 specific rooms that will be identified specific for telehealth visits that will improve the quality and experience of virtual medical visits. Currently, in the current space we are using shared space for this function, and it's pretty limited and difficult. So our original ask was for 1.5 million with our ability to match 1.7. And we're estimating a completion date of November 2023. However, with a couple of delays with design, that probably will be pushed off to January or February of 2024. And I happy to take any questions from you.
So are there any questions? Thank you, sir, for your
Mr. Chairman?
clarifications. Yes.
I guess the one that the auditor brings up is, we're down here to not a whole heck of a lot of money, and we've got a couple of counties that haven't gotten much in there. If you got 400,000, would that be a slap in the face or a welcome to the wallet?
Well, by all means, we would be certainly happy to be able to take the funds that are available for us to utilize and put towards the beginning of that project.
Well, Mr. Chairman, what I was thinking is putting 400,000 there, and then you're from Johnson County, the balance would go wherever you wanted it to in the Johnson County project.
Oh, put it on me.
Put it on you. Okay, well, you can whisper to the secretary. You can make the motion, Mr. Chairman.
Yeah, I would have to, the inpatient remodel, it'd be interesting to hear about that. So it may be, let's, Mr. Alwyn, thank you very much for your testimony. Mr. Sendin, you have the floor. If you're addressing the board, we can't hear you.
Can you hear me now, Mr. Chairman?
Yes.
Okay. I appreciate the opportunity to share. Is your question related to the inpatient project?
Yeah, well, I guess what I'm saying is if the treasurer's suggestion holds true, it would go further towards, your inpatient remodel than it would be to the medical center addition, but you could address, or actually probably not, you could address either one.
Yeah, so I'll just do a kind of a broad overview of both projects. And so we'd gotten some money and upgraded our HVAC system. Unfortunately, the overall infrastructure for how our rooms were designed, they weren't air sealed with the design and the rooms being built back in the 1950s. And so it definitely helped, but didn't give us the full negative pressure seal in the inpatient rooms that we were hoping. And so we're doing a 10-room addition that is going to give us the full negative pressure seal and provide that safety for the patients and staff that CMS and CDC recommend for COVID care. We're also, in addition to that, have a secondary hallway that gives us access to transport admitted patients from our emergency room directly to the inpatient floor. Currently, those patients have to traverse our outpatient services. So they walk down through the lab, radiology, therapy areas, and by our clinic where we have healthy patients. And so providing separation also just gives us a greater capacity to let our well patients come into our facility in a safe and friendly manner. Our clinic edition that we're doing, we currently are testing our COVID patients out in the parking lot because we have the same entrance into our facility for our healthy and sick patients. And so the desire to protect our well patients and newborn, and we do OB here as well. And so our pregnant mothers and stuff has caused our staff to then go out to the parking lot. And the last couple of weeks has been pretty cold in Johnson County as it has been across the rest of the state. And so this gives us the ability, we'll have 5 negative pressure exam rooms that gives us the ability to test patients inside of our facility and do that in a just safer manner overall. So,
So
happy to
let
answer any additional
follow up with that. You know, it strikes me that the clinic is a relatively new building, and I do know you have that one entrance. The inpatient rooms, they're a lot older, as you say.
Yep.
Some of those, it seems to me, you know, swing bed capacity and so on. And I realize you have them stacked a little bit differently. Your second priority is the inpatient remodel, and the first is the clinic addition. I just, you know, if you were going to put this money somewhere, assuming it came, which would you prefer?
Mr. Chairman, we're going to be moving forward with either project, and so the funding would be welcome for either project. I think
Okay.
so. We're
Okay.
working on getting funding secured, but anything we do helps not just us, but kind of the ability to expand and support our facilities and our staff. So.
Okay. Thank you.
Mr. Chairman?
Mr. Treasurer.
I think before I make a motion, you know, there's a few, we went through these folks that are still unfunded on the list. I don't know if there's anybody in the audience or anybody that wants to speak on their project, but you want to give them the, I guess, the opportunity to sway us on the last 867,000. Maybe we should give it to them.
Yeah, and actually, the Secretary reminds me that you have a motion on the table.
I'll withdraw that, Mr. Chairman.
Okay, and the second
so
would be.
so we can get some public
Right,
comment.
thank you for reminding me about that. So
Yeah.
that motion is withdrawn. Is that all right with you, Mr. Seconder? Okay, thank you. Mr. Treasurer, I think good idea. So let me throw it up to the audience here. I see somebody anxious to come forward. Please come up and.
Mr. Chairman, members of the board, I'm Ryan Anderson with Youth Emergency Services in Gillette and representing the sole applicant from Campbell County. So I made the trip down, figured I've been sitting all day. It's worth standing up and talking. So
You betcha.
well, I want to speak on behalf of our application 1249 for driveway and parking lot, but it's really ensuring access to services for our youth and families. We serve 1,300 youth and families in Gillette, Campbell County, and in Northeast Wyoming, and then youth across the state as well. Our facilities have seen extensive use throughout COVID. We did not shut down at all during COVID. In fact, we increased our services. We ran quarantine units. We continued to provide services and keep staff on, at any given time. And so we've actually seen the need increase, as you've probably heard today from a number of people. And so not to restate what's been said before, but the need for mental health services, for things all along the continuum of care, whether it's early intervention, prevention, treatment, crisis services for youth and families, has only gone up. We saw from 2021 to 22, actually 2020 up through 2022, 86% increase, and in the main presenting problems of depression, substance abuse, co-occurring mental health disorders only are increasing. And the tie back to COVID is we did not close down during that time frame. In fact, we saw increased traffic and increased bus traffic, which our facilities weren't really made to handle. The deterioration of our parking lot and driveway facilities have just increased greatly, and we want to continue to ensure those access to services. We're very fortunate. We have a lot of community support. We have a great campus up there. Superintendent had a chance to come up and tour it as well this last summer, and we just, from providing intervention, prevention, educational services, residential treatment. We're one of only 3 nonprofit residential treatment providers in the state that are working with those youth. And our preference would be, we would go ahead and be able to just pay this out of pocket. But anything that we take from our general fund or from any reserves really just goes against what we can provide services to those youth and families. And as a provider that is, most of our youth are in custody of the state of Wyoming, we don't really have the ability to bill more. So when we have the opportunity for this capital project to ensure, that we can address the need that's there today and in the future, we just feel that it's really critical that we continue to be able to provide those services. And I would stand for any questions.
Thank you very much. Sorry about all the moving around upstairs. I would say that the guest house is an absolutely fabulous facility. Please go ahead, Madam Auditor.
Mr. Chairman, thanks for driving down here. I'm not sure how you got here.
All-wheel drive and a little bit of Wyoming grit, and we made it, so.
So my question is, the original request you put in was for too much based on our rules. You asked for more match than we have allowed for in our rules. And so the question is, can you pick up the rest, knowing your limited financial situation? If we were to fund, the max we could give is around 420 based on our rules. And so talk to me about that, because that puts an additional, $210,000 that does have to come out of pocket.
Yes. And that was and thank you to Ms. Blackwell and their staff there. They've done a phenomenal job in working with us. And that was kind of one of my questions was are we looking at a decreased scope of project or an increased match, of which, it would no doubt be a challenge. I mean, we would go back to our city and county as well and ask them to, help with that, because it is a facility that we have a $1 a year lease from the city and county on that. And so going back and looking to that, it is a shovel ready project though. So we are, our completion date is end of 2023. And given that if there was not other opportunities from city, county, we would try to do either a scaled back project or we would dip into our reserves, which, would be challenging. I mean, there are things that happen. I mean, we had a water main break and it was a $20,000 repair, and we hate to see our reserves dip down in those situations. But we would make the sacrifice some way. We often do.
Thank you.
Thank you. Further questions? Further questions?
Mr. Chairman, I would just note that this is actually the highest ranked project that was presented to us, at least on the scoring system.
Yeah. Thank you, Madam Auditor. If there are none other, I have a couple of people online. I have Mr. McDonald. Thank you. Yes, sir.
Afternoon, gentlemen.
Yes, there you go. We can hear you.
Sorry, I didn't know how to unmute on this portable computer. We were asking for an upgrade to our HVAC system. It breaks on average twice a month. We have to have somebody come in here and do it. Last year, we spent $1.2 million in
Can
repairing
you tell which project you're addressing
the HVAC system,
for?
Memorial Hospital of Carbon County.
Okay, thank you very much.
Sorry about that. We spent a little over $1 million last year repairing our HVAC system. We are also asking for negative air rooms in our emergency room. We have 5 bays in the emergency room that are totally open, and then we have 2 rooms that are negative pressure in it.
And I think you're the only hospital for a major stretch of interstate. Is that correct?
Correct.
Okay, thank you.
Thank you.
And then I have a Kim Summerall Wright.
Good afternoon. Can you hear me okay?
We can, thank you.
Thank you. I appreciate you taking the time to let us speak. I'm Kim Summerall Wright with the Casper Housing Authority. We are representing the Willard Envision Center. And while COVID was very, very difficult for everyone, there are very few low or extremely low income people that did not suffer from the effects of the pandemic. What we have seen in the 1,000 families that we serve is when they came out of the pandemic after being laid off, those jobs that they had before, that they were working their way up, they were in training programs, they had all kinds of things going on where they were working for good Wyoming businesses. Those jobs just simply did not exist anymore. And those that went back to work are working 2 and 3 part-time jobs with no hope of advancement at all. And so what we've seen is that they're starting to give up. 90% of the people that did lose their job are not seeking employment anymore. When we spoke with them, they told us that they just don't have the skill set. And without some type of job training and supportive services, there's no way for them to pull themselves up by their bootstraps. And that's what we've asked them to do over and over. And we've supported them and we've pushed them. And before COVID, they were doing great. They had a way out of poverty. Some of them were on track to really change their lives and to become self-sufficient. Just in the last 6 years, we've seen over 60 families purchase their first home here in Casper through the Casper Housing Authority. So we sat down with all of our partners and we put together the Willard Envision Center, which is a job training facility and an expansion of our childcare facility, which also includes evening care for those that are working those 3 part-time jobs to take care of those kids and make sure that they are not in an unsafe environment. And so what we've done is purchased an old school. We've already started the renovations to the school to put the new daycare center in and to put the training center in. The partners are all in place and we just need the funding to finish the renovations. So we appreciate your consideration and ask you to consider the remaining funds to the Casper Housing Authority Willard Envision Center.
Thank you very much. Mr. Treasurer.
How much of that 2.5 is actually job training? And, because I know there's a lot of different programs out there for job training and in different areas. So I'm just wondering, we can't, I think, do much with that, but I think what we can do, if we understand it a little more, we may be able to help point you in a direction you haven't been able to travel.
Okay, that would be great. The entire project is $5.4 million. The $2.3 million includes just the training center and the childcare facility. We can't have one without the other. The Department of Family Services insists that we, of course, be in a licensed facility if you're in a job training program. And while there are some job training programs, we have lost the old McMurray Training Center has closed here in Casper. There's just limited availability for job training. And part of this project is actual paid internships and moving them not just through the job training itself, but also through personal and professional development to get them ready to go back to work. They've been at home for almost 3 years and we've got to get them back in the workforce. We just really have to do that.
Okay, well, thank you very much.
Thank
Thank
you.
you.
All right. Well, let me see, Mr. Bump, are there any other people wanting to address? Oh, up, there you are, in here, and then you said outside online too,
Mr.
Mr.
Chairman,
Bump?
we've got one more online.
Okay, thank you. Thank you, ma'am.
Thank you, Mr. Chairman and members of the board. Can you hear me?
We sure can.
My name is Linda Dalton. I'm the director of the Powell Senior Center. And I just want to, from a senior center perspective, I want to let you know how COVID affected our people. You know, they got sick, they got better, but the worst part for them was the social isolation. It just devastated them. In 2018 and 2019, we averaged 120 to 130 meals per day. That was 60% congregate, 40% home delivered. In 21 and 22, excuse me, we're averaging 150 to 170 meals a day. And that is currently the ratio is 34% congregate and 66% home delivered. I feel like we're forcing more social isolation on them, on our clients. Our clients also, you know, they're not comfortable talking with somebody about their feelings, but you should hear them at our senior center. They get with their little groups, they talk about everything. The senior center is their family, and we're there for them. You know, during the COVID pandemic, they didn't call public health, they called us. We set up their appointments, we set up their vaccinations, everything. Our current building was built in the late 50s in the late 50s, early 60s. It's just deteriorating. We have a much higher, Powell senior population is higher than the states. We have a 30% population of 60 years and older, just in Powell. We provide around 1,600 individual people in our area. We provide services to them. We have, you know, our mayor, our city council, our commissioners, they all back this. The Daniels Fund has committed $400,000, which would be the 10% contingent upon us getting the full ARPA fund, which apparently we're not going to get. But this morning, I just got an email that they cut the check, so we'll have to give that check back to them. We are shovel ready. We receive no tax revenue money to help us with any of our funding for this building. We do get a little bit from our Park County commissioners and our city for our operating, but nothing for our building. We have a very limited private wealth in our community. And the one thing I want to point out to the board is that this would be a one-time ask. This building will serve at least the next 3 generations. And I know that's one of your concerns, is that the money is effectively used for many generations. And the new senior center will also accomplish another one of those board's goals, and that's the quality of life for families in the communities to stay at home and be independent. Do you have any questions?
You, Mr. Chairman?
Yes, please.
Just that this was one of the ones that and another one I really wanted to try to find the money for, but it wasn't there. And I think what we're going to have to do is see whether or not there's any rural loans that are available, and to also find out, you know, whether or not we can look at whether or not the criteria can be developed in the legislative model to actually give us clearer direction on some of these areas. Because I agree with you 1,000%. I've had meals up there with you guys. You put out a great meal, and what you say is completely true. Everybody gets along, and it's the same with senior centers throughout the state. They're the place where they can get a good card game after lunch, or they can do what they want to do, And I think you were very instrumental in a lot of ways of allowing these guys to shelter in place so they didn't have to get out when it was. But now, I guess we're like old bears. When we get old, we don't want to get out, if we think that it's still too cold out there, and so I think we've got a lot of work to do to make sure that these funds are available and a good educational process to where we make sure that where all of them are. And I know that all your legislators are 100% behind this too, because they gave me a call and they're, I'm sorry I couldn't have done anything from the perspective of just the criteria and things that we had. But I think that you'll have an open ear to a lot of the folks who are going to be coming down this way. And whatever I can do, I'll be the biggest megaphone I can.
And thank you, Mr. Treasurer. Please go ahead.
May I speak?
Sure,
Yeah.
of course you may.
I'm Juanita Sapp. I'm
Yeah.
a physician in Powell. And the Powell Senior Center has been very supportive of our clinic and its expansion. And they provide transportation to many of our patients that don't have transportation. There is no public transportation in Powell. There's no taxi. There's no bus. There's nothing but the senior bus. And without them, many of our patients could not make their visits. And so we're forever indebted. As a geriatrician, I see older people. That's what I'm trained to do. And they have been instrumental in keeping my patients healthy during this pandemic. Thank you. Thank you.
Thank you, Dr. Sapp, and thank you, Ms. Dalton. And I think, Madam Auditor, you have a...
Mr. Chairman, not so much a question, but one of the things I think when we, the board, think about need and overall benefit to the community, senior centers consistently rise to the top, or at least of my list. And I think that it's heartbreaking that we can't get some of this funding done from this. One of the struggles, and this is where I come in and be unfun, typically the entities that need the funding the most and maybe are most in need of some help and don't have those funds, they're the least able to pay the money back when the feds come for it. And this project does not fit within the ARPA guidelines. There may be very small portions of it that does. CARES money was a little bit faster and looser than this money. They have really tightened down the restrictions, and capital projects are highly risky just by their nature of being capital projects. And it sounds like, and again, knowing all the problems you spoke of, we don't doubt any of those. A lot of those existed, and your benefit to the community and the challenges you face, they've been exacerbated with COVID, but it sounds like some of them existed long before that. For example, the transportation issues, the ADA related bathrooms. And so I'm always hesitant, again, to put our local entities at risk of having to pay this money back. And then we get into real trouble. So, Mr. Chairman, not anything of value to make the situation better, but just some of the thinking, I think, behind our decisions.
Yeah, thank you, Madam Auditor, and others. And it probably is appropriate. And I know I have two more people online. What I would say is, for everyone's information, I have requested additional dollars for this program for the legislature to appropriate some more to it. It's obvious there's need. I'm sure we'll never get it all accomplished, but I did want to share that I have asked, and this legislature can move forward to expand the program. Online, two that we've heard from before, Ms. Gambill, and I thought I saw Carmen Rideout at one point too, but Ms. Gambill.
Mr. Chairman, ladies and gentlemen of the board, this is Scott Shopa. I'm speaking for Ms. Gamble right now. The bottom line is we just wanted to reiterate how important our OR renovation project is. It's critical so that we have a negative pressure OR suite. We have an isolation corridor so we can transport patients without the general public running into them. And also to update our HVAC system. Currently, our HVAC system is antiquated, designed in the 70s, put together in the 80s, in dire need of modernization, and it has no ability for HEPA scrubbers specific to the threats related to COVID or other pandemic-oriented type illnesses that may come up. We also intend with this project to add ultraviolet germicidal radiation to scrub the air, and we just wanted to make sure that you had full and complete consideration of this project. Subject to your questions.
Thank you, Mr. Shawcross. Is Miss Rideout, I thought she had her hand up earlier, Mr. Bump. She took it down. Okay. Oh, nope, she's put it back up. She took it back down. Back up. It's like ping pong. Carmen, please go ahead.
Hello, this is Carmen Rideout from the Hub on Smith, and I just want to thank you all for your time and making hard decisions. We're disappointed that we didn't get funded today, but hope there are some other opportunities. I think Linda Dalton said it really well. What we do impacts primary care and it impacts mental health for people in our community. And I just want to say thank you, and I hope to be before you again in the not too distant future.
Yeah, thank you, Carmen. And just to reiterate, and you, by the way, have potentially the chair of appropriations that you can talk to directly and talk about the significance of this program. So thank you very much.
Thank you.
Dr. Dammeier.
Yes, this is Matt Dammeier. This is in relationship to Project 1093. Completely respect the process here. You all are faced with obviously a challenging task, but I've been impressed with your memories, both of these applications and previous CARES funding. And so there was we were in that small group of projects that were recommended for funding and received no funding. Again, not expecting feedback, but I just want to clarify there was a comment made in another project about the scoring. And I just wanted to address that we didn't get any feedback about the score, but we had one of the lower scores. And if there is future funding that we go for, I want to clarify that the scoring criteria in Chapter 40, Section 10, those 7 criteria are fairly objective. And our assessment was we expected to get a 16 or a 17, no less than a 15. And so, if that was the reason that we weren't funded, I just don't want in a future attempt for people's memories to say, oh, that was that project that received that really low score. Again, I would defer to the reviewers as to the reason if it comes up again. But just want to make sure that those memories aren't carried into the next round because we believe, again, those criteria are pretty clear and that score is not reflective of our project. I didn't bring that up just simply because we were recommended for funding. And again, not expecting feedback or explanations. Respect the process completely. And I thank you all for your time.
Doctor, thank you very much. And I don't know, Auditor, if you...
Mr. Chairman, no, that's a great question, and I think you deserve sort of an answer or some feedback, and I'll speak for only myself, and then anyone can certainly disagree. This is the first time we've done this with the ARPA funding. We did the CARES Act quite substantially different than this, and the scoring is one component
and only one component of what we look at. I agree with you that it's fairly objective, although I think certainly we could nitpick between, yes, I really think that project should have gotten a little more, and I've had those feelings, and that's fine. When we selected that scoring methodology, we were doing the best we can with no information on the types of applications that were coming in. So we were sort of building the plane as it flies, doing the best we can. I mean, one of the things that I would, as an example, one of the components was, can you provide, X back years of audited financial statements? Well, if we're funding a new entity, that's really an unfair thing to get really knocked down on. So again, I don't want to say the scoring system wasn't utilized, but I think we've learned a lot from it this time, if we do have to redo that. Now, in your case in particular, and again, only speaking for myself, I think you had a great request. I think Converse County is the best little hospital in all of Wyoming. Yeah, I mean, what you guys do with where you are and the resources you have is just phenomenal. And the cafeteria is real good too, for anybody that's wondering. My vote on your project had to do with the amount of funding that you received during CARES. So again, not a knock against your application, certainly not a knock against any future applications, but just some explanation of our, lots of different components. You'll hear we talked about wanting to try to spread this funding out geographically a little bit too. So I'll stop there, Mr. Chairman.
Very good, thank you. All right, I think we've come to the end. I really do appreciate all the comments. I know we're down to the sort of the last of what we've got. Again, reiterate the fact that in my budget requests, I've asked for additional monies to be put into this program. I don't know if I can speak for the board, but I think the board feels that every one of these projects is meritorious. We just had to make some choices. I don't think it takes them off the schedule for all time at all, in all cases, especially if we are able to get some more funding in the program. And I stand ready to parse the remainders. And Madam Auditor or Mr. Treasurer,
And before we get there, I just want to say that I think that the one big hospital that didn't get funded in Crook County, I think that they're going to be, getting themselves on the road to success. And I think that they'll have all their ducks in a row with that extra funding that you're bringing forward. So I think they'll be in good shape. We'll just have to finish up the polish on the apple, so to speak. I guess I will start with my original one, and then which was the motion for $400,000 for 1231 Hot Springs County District Hot Springs Health Thermopolis Clinic remodel and expansion. I know it's not a lot, but maybe it'll will help them get that going down the road. Would ask for a second and favorable consideration by the committee.
How much?
So that is for 400?
400.
Okay.
And just real quick, Mr. Chairman, what number?
That's the 1231.
1231?
1231, midway down the page, the second page.
So 400,000.
Yep. Is there a second?
I'll second it.
It's been seconded. Is there any discussion from the board?
Mr. Chairman.
Madam Auditor.
I think this is a great project. I'm going to be a no vote on this specific motion because I would prefer to get a couple smaller projects funded in their entirety or real close, as opposed to sort of, 25% of a larger project. That's all, Mr. Chairman.
Thank you, Madam Auditor. Other comments, other questions?
Yeah, Mr. Chairman, I thought we heard from the testimony from the Hot Springs people that the 400,000 would be helpful. I think I phrased it rather indelicately, but I think that I got the answer that the 400,000 would be helpful.
Okay, thank you. Further comments, further questions? Motion's on the table before us, 400,000 towards item 1231, Hot Springs County Hospital District, Hot Springs Health Thermopolis Clinic remodel and expansion. All in favor signify by saying aye.
Aye.
Nays? I'm going to be a nay on this too, because I think, I think we can do a couple of projects. So that motion fails. And I do want to see Hot Springs get funded hopefully we get some more money for that. So,
Mr. Chairman,
Madam Auditor.
I would move approval of $420,031 to project 1249 Yes House.
Is there support for 1249 driveway and parking lot youth emergency services?
I'll second it, Mr.
It's
Chairman.
been seconded by the superintendent, moved by the auditor, and 400,000.
420031, and that's the max amount if we are following our rules.
420031.
Mr. Chairman, and this is for a parking lot in Gillette? Is that right?
Yes.
Yep. All right, further discussion? Further discussion. All in favor signify by saying aye.
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 Nays?
No.
And that's a no for me. That motion does carry. So that leaves us with 440 or something like that?
Mr. Chairman.
Mr. Chairman, 447,945.
Okay.
Mr. Chairman,
Madam Auditor.
I would move approval of the balance 447,945 to
Johnson County Hospital District.
1237 Memorial Hospital of Carbon County, recognizing they have come for us for almost nothing. They got very limited CARES funding from us, and I think the HVAC type nature of their request is very appropriate for this pot of money. And although that doesn't get them to their full request, it gets them within shooting distance.
Is there support for the auditor's motion?
Second.
It's been seconded by the superintendent. Is there any discussion? Any discussion? All in favor signify by saying aye.
Aye.
Are there nays? Motion carries. And
Mr. Chairman.
Mr. Secretary, sorry.
Mr. Chairman, I would move that those items that were either not funded or not denied funding, those that still haven't been addressed there, that we put those, we table those until a future date,
Second
pending
for
more
the,
funding.
second for the motion?
Second?
Been seconded. All in favor signify by saying aye.
Aye.
Motion carries.
I wish we would have had about $1 million from county over there.
So members of the board, good work today. Thank you for those of you who sat through a day. Appreciate very much the work that everyone did. I especially want to thank the staff of OSLI for your work, not only today and the other days, but also your work with the applicants, and thank you very, very much. Members of the board, is there anything else to come before us? If, let me ask you, and then I'm going to ask the director. I hear nothing, Madam Director.
Mr. Chairman, that concludes the agenda items for today. I would just echo your praise of OSLI staff. They've really worked hard on some of these tedious issues, as well as our Attorney General's office representatives. They've been in the weeds on this too. So thank you very much.
Yes, thank you, Mr. Miller and Mr. Peters. Madam Director, I think we still are on for a State Board of Land Commissioners meeting tomorrow. I did notice it's been noticed.
Correct, Mr. Chairman. There is an agenda and a board matter posted. The board will convene at 1 o'clock tomorrow afternoon for the Land Commissioner agenda item.
Yeah,
Thank-
and Mr. Chairman?
And Mr. Treasurer.
I want to pay particular attention and thank one of our new best friends as far as federal agencies, the USDA rural loan programs. I don't even know if they're around, but hopefully they hear this because I think that they've really helped us and given us a way to leverage these grant funds. And hopefully we'll even work closer with them and closer with the applicants that are and potential applicants to let them know way in advance, a year and a half for a loan to get moving on these things. Thank you, Mr. Chairman.
Mr. Chairman.
Madam Auditor.
I would just really like to compliment the Secretary of State. He has less time on this board than any of us, and he could about run laps around me, I think. So he has just done an amazing job of getting up to speed on these issues. I've been in 4 years and I still don't know what I'm doing. So good job, Carl. We really appreciate you.
Yeah, I would echo that. If there is nothing more to come before this board, I would entertain a motion to adjourn.
So moved.
It's been moved. Is there support for the adjournment?
Second.
Oh, I thought that was going to go wanting. All right, all in favor signify by saying aye.
Aye.
We are